Lovely to see you all. I never did get... Okay. Well, are we all ready? Okay. So welcome everybody to today's meeting of the Children, Adults, Health and Wellbeing Policy Development and Scrutiny Panel. Today's session focuses on the children's side of our remit. So I'm going to now ask the panel to introduce themselves, and then I will ask you to introduce yourselves as well. So, my name's Dina Romero, and I'm the chair of this panel. Liz.
Morning, I'm Liz Hardman. I'm vice chair of this panel.
Chris.
Morning, Christopher Patton, National Education Union non-voting member.
Alex.
Hello, I'm Alex Beaumont, and I'm the Councillor for Keynsham North.
David.
David Harding, Councillor for Chew Valley.
Joe.
Joanna Wright, Lambridge Ward.
Kevin.
Good morning, Kevin Burnett, non-voting member from the NEHT.
Thank you. And Leslie.
Morning, I'm Leslie Munsell, I'm the Councillor for Radstock.
And also a member of this panel. And so start at the back there, Chris.
I'm Sarah Watts, Complaints and Data Protection Team Manager for Children's, Adults and Public Health.
Morning everyone, Laura Ambler. I'm from the Integrated Care Board and I'm the Place Director for Baines.
Hello, I'm Paul Scott. I'm Associate Director of Public Health, but I'm here covering for Becky Reynolds, the Director of Public Health.
Good morning, Chair. I'm Paul May. I'm a councillor from Pensford and Whitchurch Village, and I'm the Cabinet Member for Children.
And we're delighted to see you today, Paul.
Thank you.
Morning, Chair. Mary Carey Knowles, Director of Children's Services for the local authority.
Thank you. And then Mark, and then Kerry.
Yeah, great. Thank you, Chair. My name is Mark Durnford. I'm the Democratic Services Officer for the panel.
Morning, everyone. I'm Kerry Williams. I'm the Policy Development and Scrutiny Officer for the panel.
Right. Has anybody been missed? Excellent. Well, thank you very much.
Chair, I know it's a funny thing, but I'm very grateful, Mark, that we've got everybody's names, but it would be also useful to have them for the other members who come into the room, the officers who come into the room, because it's as important to know who they are and remember who they are if there was a guest list here watching.
If that's possible, Mark, could you make that so? Thank you. But actually, and also for members of the public who might be watching on our webcast, it would again be useful to know who's who. Right, so we move on to the emergency evacuation procedure now.
Yeah, great. Thank you, Chair. Yes. So if the continuous alarm does sound, you must evacuate the building and proceed to the assembly point. From this room, you follow the green running person signs to the exit, using either the marble staircase or the main staircase. Please do not use the lifts. The assembly point for this building is the Orange Grove grassed area, just outside Brown's Restaurant. There's an evacuation chair for use by disabled people who so wish in the corridor outside the Council Chamber Public Gallery. Alternatively, the area at the top of the marble staircase has been designated as safe refuge where persons needing assistance should assemble. Thank you.
Thank you very much, Mark. Apologies for absence and substitutions. I'm aware of one or two, but Mark, please could you fill us in?
Yeah, I'm just aware of one, Chair, so Councillor Michelle O'Doherty sends her apologies to the panel.
Thank you. And I suspect either Councillor Crossley will be late or may be missing. Laura.
Thank you, Chair. If I may, I'm just noticing that my colleague, Victoria, who was due to give an update on community pharmacy, is not here at the moment, and I haven't had any confirmation of if she'll be able to attend. So may I suggest that if my colleague isn't able to attend, that I bring that to the next panel, if you're in agreement?
Yes, but maybe we might perhaps put forward any comments that we already have on that item.
That would be
because that would obviously help her for that update.
That would be really helpful. Thank you, Chair.
Okay, thank you. Declarations of interest. Does anybody have any? Paul, what is your declaration of interest?
Chair, I always declare it. I'm a non-executive director on the board of Serona, and they deal with BNSSG and children's services and adult services. So I think I'll declare it. I don't think there's anything that we'll have to leave the room for, but I always declare it. Thank you.
Thank you very much, and we're always grateful that you are as transparent as you are. Thank you. Okay. Any other declarations? Okay. So the next item on my agenda is to announce any urgent business. I have two, and then I know there is another as well. So first of all, I wanted to say to the panel and obviously to the public as well that our inaugural meeting of the Knife Crime Task Group has happened. We have set our terms of reference, and there will be, we're looking to have a rapid work plan as we move forward, so that we can bring forward the appropriate recommendations as soon as possible for the relevant parties, which will of course include the Cabinet member too. We are also planning on meeting with Sue Harriman, who is the Chief Executive of the Integrated Care Board. Also, we wanted to raise a point on Charlton House that we had our specific questions about in our last meeting, but the answers we got were not as full as we later learnt that they ought to have been, and so we wanted to raise that as a point. I don't know whether Liz, you wanted to add anything further to that.
Not a lot to add to this, but just to reflect the concern and disappointment amongst us as a panel that we weren't involved about the possible consultation that was going to take place about the future of Charlton House, especially as we did raise questions, as you said, about it, and the answers we got were very generalised. So a disappointment that we weren't consulted about this, and obviously we would hope that this will be brought to our next meeting in December, where we will have a full explanation of the consultation processes that are taking place.
Thank you, Liz.
Has that been conveyed to the Cabinet member? Would you like me to feed back?
Just park that for a moment,
okay.
Paul. Jo?
I was of the impression that we were going to ask for this scrutiny panel to write formally to the Cabinet member to say our disappointment, because this is the second time that we have been let down, previously the LGA review and now this, and that we would like that written from you as chair on behalf of us as scrutiny.
And as I said, I was happy to do that, and so in answer to your question, Paul, that is what we will be doing. We'll be writing to Councillor Bourne to express our disappointment, particularly as a very specific question was asked in that meeting about Charlton House, and that was a good opportunity for this, the consultation to be, and the issue to be raised. So, but it was very much a missed moment. Perhaps it was inadvertent. I'm not going to speculate on that. But what I would like to add is the update that's been requested, that comes to our next meeting of the adults side of our work, and that update comes before any final decision is taken by the Cabinet. So therefore it is, even if it is outside the consultation period, it is in effect taken as part of that consultation. Okay, is everybody happy? Leslie?
Could we ask as part of that we see the equality impact assessment on that decision as well? Thank you.
Thank you. Yes, and so can we make sure that is very clear within that in fact, as just an additional point, I think we would like and expect, in fact, to have equality impact assessments on all of our items too. Okay. Anything further on this matter? Okay. Right. So those were my urgent items. We now move to the items from public or councillors. I note we do not have any members of the public within this room. Hopefully there are some watching online, but we also don't have any councillors outside of the panel either. But I would like to just stress that we do have a moment at this on this agenda to receive statements, petitions or questions, and also missing members of the panel too at this point. And so if anybody does want to raise any item, then we're always open to that. We now move on to the minutes of the 9th of October. So that was our last meeting, and that focused on adult services. And as we've already noted, there was commentary that perhaps was missed during the cabinet members' update. Are there any other points that are inaccurate on the minutes that any of the panel would like to raise? If not, then I will take that as a acceptance that they are indeed an accurate record of that meeting. Okay, all those in favour of that? Excellent, thank you. Right, we now move on, once I found the right place on my agenda, to today's Cabinet member update. So we have all, I assume, read this. So is there anything in addition that you wanted to add to your report, and then I'll open it up for any questions?
I think only just to highlight again the problems that the department are having with regards to the demand and complexity of cases that we're dealing with. And I've taken the opportunity with my report to be open about that, because in terms of scrutiny, it's great if cabinet members come along and just say everything's wonderful, but at the moment it's really, really difficult for the staff, and I've reported that. And the other thing, Chair, is just to give my apologies for the last meeting that I missed. I've been a bit poorly, so it wasn't any disservice to the committee.
Thank you very much, Paul, and I hope you got our best wishes then. Okay. So, any questions or comments from the panel? Kevin.
Thank you. Hello, Paul. Good to see you back. Around the pressures, there's two questions. One's around budget, and well, three actually. One's around budget, one's around the considerable pressures as a whole, and one's around the early years childcare. As a whole, you do emphasise the considerable pressure resulting that is at the current time. Could you tell us whether this is going to lead in deteriorating service, or when that might happen, and how is the wellbeing and staff holding up under all this?
I think that's a really good question, Kevin. I think I can always refer through to Mary, but I've seen really experienced, good staff that Baines have actually operating under stress at the moment. And there's a limit to how long you can do that for. So I'm keeping very close to what's happening with them. I meet them on a regular basis and we talk through. I've sent letters out to staff saying, we understand the pressure you're under and actually thank you for all the support you're doing. Where necessary, I've mentioned around the SEND side, we lost a senior member of staff, we've reappointed, and Chris is bringing in some temporary staff, and we're doing a review of the system. So we're doing everything that I think we can do at this moment. In terms of the budget, unfortunately, there is going to be a price to those pressures that we're dealing with. I mean, if you're looking at the education healthcare plans, we've had double the number that we had just a few years ago, and in effect we've got about the same staff. So there are issues there about how we're going to move forward we're just moving into the budgetary process, and the budgetary process there will be bids coming forward to actually fill some of those gaps. And where we have to, we do employ agency staff, but as we all know, agency staff are really, really expensive.
And probably not as helpful as permanent staff who actually know the game.
I think, yeah, I mean, it would be lovely if we had, the staff to do it, but it's about the experience of the staff. The agency people that we get in are highly experienced and deal with court cases and some of the things that our own staff at the moment aren't able to do, but it's something that we're keeping under close control, and the additional cost is offset against the fact we haven't got the staff to do it. So it is there, it's in the budgets, and that will be open to scrutiny, Chair.
Can I keep going, Chair?
Go on then.
Are there, is there anything that can be done in terms of, well, political pressure, anything? Because obviously the funding comes centrally. It doesn't come, sadly, from Baines, probably, most of the funding. Is there anything that's being done at the moment to try and further this or get support?
Could I ask Mary to answer that? Because I'm aware that there's a lot going on.
If I can add to that, and just to give assurance, we have got a really well-established staff group, and we've managed to retain quite a lot of our staff through this period. I think it's fair to say that the service has been under pressure since before the pandemic, and certainly what we are seeing in terms of the needs of our children and families continues to be very complex. So it's both demand and complexity. In terms of what else we're doing around recruitment, so we have implemented a retention policy for our safeguarding outcomes part of the service, because that's the part of the service which has been really challenged. We are also looking at how well we compete against other local authorities in terms of recruitment. So there's quite a bit of work happening around that area. In terms of lobbying, we lobby through ADCS, which is the national body for all directors of children's services. So there's been regular lobbying to the DFE in terms of the pressures that all local authorities are under, because the pressures we're under are not dissimilar to other areas. There's been an increase in demand and complexity regionally and nationally. So we lobby through the ADCS, through the DFE, and more recently we are also lobbying with South West Councils in terms of the National Dispersal Scheme with regards to unaccompanied asylum-seeking children.
And Kevin, just carry on for a second. I mean, on the SEND side, we now fall within the safety valve, which is hopefully going to help us sort out some of the accommodation issues and children going out of area, and also the chair will understand there's a regional meeting of lead members, and we've raised the issue there with them about unaccompanied asylum-seeking children, because it appears as though across the southwest the numbers that some authorities have got, like us, are high relative to the 0.1% that they set the target. Others don't appear to have taken all their children. So at the moment, we've just notified them that we're going to be putting a hold on taking any more, because the issue around the unaccompanied asylum, it's not just the money that we get for dealing with them, and I've said there, we should care for them. That's not the issue, but if their case isn't dealt with by the Home Office by the time they get to 18, they then come into our requirements around 18 to 25, and there's no funding actually given for that. So it's a real cost issue. And, I'm dealing with my colleagues around budgets, and, we're sat there, these pressures are real pressures. There are real pressures in other local authorities. But, you then have to have the discussion with your colleagues about overspending on the budget. So it's a difficult time, I think, for the children's services.
Thank you, Paul and Mary. Hopefully the new Home Secretary will be doing something about that particular issue. I'm sure be aware as well, so I'm a substitute on the LGA's Children and Young People's Board, and it is an issue that is raised there as well. I just wondered whether or not we ought to have an item specifically on EHCPs at this panel, because it is an issue that as ward councillors we also get asked about a lot, particularly around the delays, and it would be really good, I think, to get a proper understanding about how and why those delays happen, and if there's more we could be doing either as a council or asking of our partners that the EHCPs are timely, but also that they are actually in place and doing something as soon as possible. Yeah.
Chair, I'll willingly take that on, because the simple fact is at the moment, because we've had shortages of staff, we're now in the situation where we've got lots and lots of complaints. So the complaints then slow down the process of how you deal with the cases that you want to be dealing with. So I think we've got a new lead officer in, and I'm sure Chris will be pleased to bring back a report and perhaps introduce her to the committee, because it's something that we're trying to catch up with, and we're putting in some additional resources, and we've also pulled in a consultant to look at the processes to make sure we're actually working as effectively as we can.
Thank you, Paul, and I can see Chris's pleased face. Yes.
Absolutely, yeah. We're working really hard to try and improve things for people who've been on this committee for a while will know that I previously used to be the head of education inclusion, worked really hard to get that team functioning well, and we pride ourselves on the service that we can deliver. We're still, in some parts, are delivering, I think, a really good service. Some of our feedback from our parents is still really good. Where we're really struggling is the capacity to manage the number of requests for assessments which are coming through the door, and that just it isn't it's a complex system, as we'll put in the paper, and we are reliant on a number of external partners with those assessments, if you like. So the LA holds it in the middle, but we'll be looking for support from our speech and language therapy colleagues, our occupational health colleagues. There's information which we need, which sometimes comes in delayed for us to write that report. But it still remains our responsibility. We work really closely with our health colleagues to try and resolve some of those issues. The team are absolutely committed to improving. We've got a really good plan in place. I think we've recruited a really good service manager. All the staff that work in the service want to get the high standard of service back up. A number of people working in that service have got children with EHCPs themselves. They're really, really committed and passionate and committed to what they do. So I'd gladly bring a report here to talk to you about all the things we're trying to do, from improving the IT we use to having more automation services so parents can get access to information quicker. But we are keenly aware we're not up to where we should be. My colleague to my left has been kept busy over the last few months, but we will be better, and we'll make sure the report contains the steps we're taking.
Thank you, Chris. And can I add, before Leslie mentions it, that personally I'd be very interested in an inequalities impact assessment on who is receiving an EHCP and also who is not. Because so with a different hat on as the chair of the race panel, I'm aware that there have been concerns about some groups that are less likely to even move forward with an EHCP, even to pursue one. So that'd be interesting. Thank you.
Chair, can I just, the other point is we are an outlier with EHCPs, and we haven't actually pinned down why that is the case. We've got a white middle class community that raise issues and they follow things through, but it's something that we need to be thinking about. So I think bringing the report back would be really good. Thank you.
Thank you, Paul. Joanna and then Kevin.
Hi, thank you. Good to have you back, Paul. So, as you know from the budget papers that came out, that we are you've got a shortfall of 4.45 million coming over budget coming up. This is a sizable amount. I have two questions. One about the independent foster care system that you have in place. And two, about leadership. Now, I've no doubt that the leadership that everyone in this room is giving is of high quality. But, you know, it's clear that we have a lot of agency staff, and agency staff are paid better, and people know that. So it becomes, therefore, self-fulfilling that people think it's better to be an agency staff. Equally, with the situation with independent foster cares, it's better to be an independent rather than a in-house. You get paid more. And I'm just wondering if there's a different way of us rewarding service within the council and a different structure of thinking about leadership. Because, and I'm just making this point as a side point because I love to have a little go about AI, because AI is never going to replace any of you. You know, what you do is fundamental and no one's going to replace you. So therefore, what can we do as a council? And I'm also looking at Dina in her role as mayor. What can we do that supports those groups of people who aren't paid as much to either get more holiday, more rewards through the council, that then makes them feel part of the team in a different way. So we endlessly add value to that group of people. Because at the end of the day, if you don't have that group of people, you don't function at all. And it hopefully costs us less going forward. So I guess those would be my points questions.
In terms of the points, I absolutely agree, Councillor Wright. You know, I think we're in a situation that's really difficult. It's not just agency staff, it's other local authorities if they're paying more than us. And Mary's already outlined some of the things that we're looking to do to try and keep the good staff that we've got. We're still a highly attractive local authority for people to want to work. And I think that's down to Baines being an authority that cares about its staff. So we'll be picking that up and we do that. But Mary's talking to the director all the time to try and find ways in which we can make it more attractive, A, to keep the staff, the good staff that we've got, and B, to try and get new staff in. But one of the key issues is if you get new staff in, their degree of experience that they've got can be a real tension, and which is where we're spending money on agency staff is really around their expertise more than just bodies.
And if I can add, we've reduced our usage of agency staff within children's social care quite substantially in the last year. We've only got a small number, but as Councillor May has said, those are experienced social workers who are able to go to court and hold cases, whereas in our safeguarding outcomes, many of the staff are newly qualified and they're not in a position to be able to take cases through court. So while we are paying some more for those staff, actually what they've brought to the team in terms of expertise and knowledge has been really positive. There is work happening nationally with the DFE about looking at some regulation around the agency market, but it is unlikely that will come to fruition in this current government. But some of the areas that have been considered nationally is that you couldn't work for an agency unless you've been qualified 3 years, for example, and or if you've left a local authority position, not to be employed as an agency worker. So
with the agency staff, is there a sort of ability of learning through this internal staff of what they're doing, so that knowledge base is shared?
Absolutely, it is, and they're part of the wider team, and we work really hard to balance within a team, knowing that some staff are on a different rate than other staff, but we maximise the usage, so to speak, in terms of the contribution to the wider service while they're with us.
I don't know if you wanted to make any comment about work you do to try and encourage agency staff to become...
I was just looking at my question. Yeah, so we've done a number of things. We've gone through 2 periods of onboarding where we've worked with the agency staff about would they come and work with us full time, because what we hear from our staff is that they really like working for Baines, they like the practice model, they like the support, they like the approach. Some of them have come on board, and when I've met with them all individually myself in terms of having an onboarding conversation, and what they're saying is that the agency provides them with a level of flexibility and a rate that we can't match, unfortunately. However, we have successfully retained the staff within the safeguarding outcomes where we have offered the retention fee, and we're just about to look at as people come into the local authority, for offering a higher rate to work in safeguarding outcomes. So we've done some further work and we've benchmarked regionally, and what we're seeing is that other local authorities are offering more for entry-level positions, so we're going to match that as well. So we're constantly looking at who's doing what can we learn from, and what our staff tell us. We meet with them regularly. Councillor May has mentioned he's written to staff twice to thank them for their efforts and recognising its challenging times, and that's been really well received. So it is an ongoing conversation about what more we can do and our availability. Chris and I, between us, are in the office each 3-4 days a week so that we're visible, we're approachable, we're working with staff, and that they can come see us directly, as well as, you know, the usual team meetings and so forth. In relation to foster care, in terms of IFAs, we've worked really, really hard to promote and increase our number of in-house foster carers, and we're absolutely going in the right direction. We now have more children placed within foster families within Baines than we have in terms of IFAs, and we're constantly looking to onboard some of those foster carers. The other area we've just done, we've moved supported lodgings, which sat with our housing department, and it moved into our family placement team in July this year. So we're just going through the process of that being registered with Ofsted. So we will be looking to do a major campaign around how we can expand that provision. So again, if we had more local homes that provide some supported lodgings, that will go a significant way, both in terms of supporting young people locally, but also addressing our financial position, because many of our post-16 provision are outside of the area.
Okay, and just picking up on the foster carers, is there any way that we can do anything within Baines as an organisation that makes them feel more valued? And I'm looking more at Councillor May and the role of the mayor, and what we could offer that, you know, as a way of feeling, they're a really important part of our community, and how do we value that and show that value?
I'll take that point on board. I know every year we do an annual event where we invite all the foster carers in, and it's always really special because it's not just the current foster carers, it's previous ones, and that goes down really well. I think the big challenge is we were taken into a sub-regional foster arrangement, which hasn't necessarily worked to our full advantage. That's my view. I can tell from Mary's body language she doesn't necessarily agree. But the simple fact is it's about us, it's about others, but I think I'll take any ideas forward if we can improve that for our local foster carers, because they are a really, really valuable part of our approach to young people.
Thank you. And I would just add to that. So the Mayor of Bath is of Bath. So yes, whilst I could, host an event perhaps for foster carers of Bath, that means that North East Somerset therefore would be missed out. And many of our foster carers are North East Somerset, and actually some are outside of our borders as well. So, but I will give it more thought as well, Joanna. Thank you. Kevin and then Paul.
Thank you. Just to tie up the last point around the budget, if I may, Paul, just in your report, you do say that savings are still online to be done, but I presume that's part of maybe a little bit, but overall there's a deficit?
A simple answer from a politician, yes.
Okay. And then two other quick things. One around expanding early years childcare. I just wondered what the feedback from local officers and early years reference groups have been, because the general consensus I've heard so far is that this is totally inadequate money and that the scheme won't work. It will just fall flat. And if you're trying to have primary schools as well with wraparound childcare, where are the staff coming from? And most people are going to Aldi for a better rate at the moment anyway. And finally, the sector-led improvement initiative that I just saw a quick note of. I didn't know whether that bid was going to add to the pressures on staff or whether it was something that was coming externally to give you a wonderful additional resource somewhere.
I'll get Chris to answer on the early years, and then I'll come back on the other question.
Thanks, Kevin. I think you hit on probably the most pertinent issue around that, which is the staffing, which is something we're keenly aware of in Baines, and that is the challenge. We welcome some of the announcements. We've yet to see the detail of them, and we got them just the Friday at the end of half term, I think. So there's a lot more detail that needs to be unpicked by officers. As you know from sitting on Schools Forum, Kevin, that Philip Franklin will now take that information to some of the early years reference group, start to unpick it, start to get the feedback. So I wouldn't be able to say exactly what our early years colleagues have said yet in any detail, but I'm sure there'll be a report that comes to the next School Forum where we've got a bit more detail around some of that information. We can certainly share some of that back here with Scrutiny. But staffing is the thing. We welcome wraparound childcare, we welcome the additional places, we welcome the capital to support it, but we have got to get to the heart of some of the issues around the pay rates for our staffing in the early years sector, and we need to look at what will happen with that finance, bearing in mind that providers' costs are going up as well in terms of rent, in terms of things like that is a challenge. In Baines, we're just about to do a piece of work on supporting recruitment. So we're working with a local authority company who develops websites similar to what we did with the Proud to Care adult social care. We're going to support the early years sector in Baines with the development of a web page where they can all centrally look to promote their vacancies. We'll be using that to also promote the sector around training and support and information. So we will do what we can to support the sector, but I'll hold detailed comment until we've got to grips a little bit more with the actual specifics of the announcements which just came in a week ago. But happy to share some of that information at a later cabinet report once we've had a report to Schools Forum.
Thank you.
Sector-led improvement. I mentioned around the South-West of how we work together, and Mary has a key role in that. You asking the question whether that then takes away the commitment, if you like, to the job. But I think if, like any other job, if you don't actually work with your colleagues across an area, then you actually then find you become isolated. So I think from my point of view, I've always supported any engagement on the region, and I think it's nice that I've seen recently the Department for Education saying to me quite openly that they think that our officers here are working really effectively with them, and that then actually then has a positive message back into the system. But in terms of the details, would you like to, Mary?
So there's two areas. Historically, unless you're a solid, good local authority, you can't put yourself forward to lead pieces of work across the South-West. And as we were judged good in all areas by Ofsted in 2022, we're now eligible to put ourselves forward to lead pieces of work. And certainly across the service, our Assistant Director, Lee Zayak, has been very forthcoming and leading in terms of pre-proceedings work, and doing some joint work with the judiciary around that. So we have put ourselves forward to be considered as a leader in terms of sector-led improvement across the South-West. We don't know yet if we've been successful, but we were eligible to apply, so we did. And we just last week have submitted a bid to the DFE for Wave 2 of the Pathfinder. So that's the funding that has come through in terms of the care review. Again, we won't know to January. In terms of the capacity to submit the bids and lead on them, that will be led at assistant director or director level. It doesn't so much impact in terms of the frontline practice or the managers. But if we were successful, we previously applied to be a family hub and we weren't eligible. We'll know in January if we're successful. But certainly the funding that's been made available by the DFE around the review of early help would be really welcomed. But we'll know in January.
That's probably key. I mean, generally, sadly, when I was in the position of taking on challenges or not, if it only affected me, I was happy to take on the challenge and get the money in. But if it affected the teachers in the classroom, that was another issue. Okay, thank you.
Well, hopefully, if you know in January, it'll be in time to be part of Paul's report. Yes, thank you. Okay, Leslie and...
Very much. Before I get to my question, in answer to the question about the annual care event, it is a great event. I've been twice in the last 5 years, I think. And one of the nice things about it is that you're invited to bring your partner as well. So it's a very friendly event. So if you could just tell us when the next one is, that'd be helpful. I know all councillors get an email invite, but obviously some people are missing that. And with 100 emails a day, it's easy to miss some. Can you make sure that people on this panel get a personal invite, and including the non-councillor members of the panel, because it is a really good event. My question, though, is about staff and flexibility. You said that was a problem in recruiting. What is the issue if someone wants to work for us very flexibly because of their situation in life? What holds us back adopting contracts to meet their ability to work for us on non-standard lines? Why can't we offer non-standard contracts to people that can only work non-standard hours?
We are absolutely able to do that as an employer, and we are incredibly flexible and agile in terms of the contracts that we have. The agency staff who we've employed have said that we can't match their salary, so that's why they've chosen to remain agencies, because of the flexibility and the salary. But we are as flexible as we can, and we've worked really closely with our OD and HR around flexible contracts. We're incredibly flexible. We support secondments, we support all sorts of ways of working to retain our staff. Thank you.
And if I can just add, it's 4 years since I've sat in this chair, and the pressures on the staff, it's just, I'm really shocked at, having come in again after 4 years, the pressures on them is really, really enormous. And it used to be, there was only 2 good authorities in the Southwest. Now there's about 5 or 6. That puts more competition into the employment marketplace as well. So it's not just about the agency workers, it's about workers who may or may not want to go to other areas. But it is something that we're working on all the time. And I've got to say our HR people and OD people are really, really helpful in that, because it's also about how you develop staff through, not just about the job that they're doing at the moment.
Thank you. And I'm sure there's a point to be made about ensuring that nobody is under undue stress as well within that.
But in my report, I have highlighted that I've seen the stress on staff, particularly around children's care. It's really been quite enormous. We've had 3 or 4 really, really bad cases recently. And that then, it's not just about the stress of dealing with that case, but you have to then deal with it out of hours and a whole series of knock-on impacts on families. So we're really, really sensitive to that, and we're trying to help people through those difficult times.
Thank you, Paul. Leslie.
I wanted to ask a question around staffing as well. I mean, I work in the NHS, and we have very similar issues. COVID hasn't helped. We haven't really recovered from the stress of that. But we're having exactly the same issues around recruitment, retention. I just wondered, you've touched on it, but I think in the light of the responsibilities of this committee, the impact of not having enough staff on the service will long-term not be helpful, and certainly is not a positive impact at the moment. So the question for me is, what is being done around asking people why they leave or why they remain? It isn't always about pay. Sometimes it's about having those flexible working options or benefits for staff. Sometimes it's around the environment. Sometimes it's around being able to get to work, transport systems, especially if you're coming from outside of Bath, from North East Somerset or even further, with the poor bus services that we have. So what intelligence do you have on that? And also around stress levels. You've already said, and it's going to go in a minute, there's stress levels. That should be of a great concern to us because that is not going to get any better. So what kind of initiatives are there around reducing those stress levels for staff? Thank you.
I'll start. Mary can come back with the details, but I mean, they go into the Keynsham office, and the Keynsham office is at the moment split up a bit, and social workers need to have a place where they can meet and talk and things like that. And we're pressing now to actually get a dedicated area for those social workers to be able to do that. I think it's such a general question, it's really quite difficult to answer in specifics. But I mean, we are aware and we are working, and I'm including people in this room. I've seen the stress on them. And what we've got to do is we've just got to make sure, and my role as a cabinet member is to make sure that other people within the council are aware of that, because there is, the knock-on impact of overspending is somewhere else. Somebody's got to have a cut. And all I can say is that every opportunity I've got, I've been saying the complexity and the volume of cases that we're dealing with are so high that it is causing that problem. And I could have just not made mention of it in my report, but I think it's right that we actually do recognise the Scrutiny Committee's role, and that we will be as accountable as we can be to you for that. And I know that Mary and I are actually doing everything we can to actually deal with that stress in our staff.
And if I can add, what we are also looking to do is increase our staffing as part of the budget setting process this year. Despite us having challenges in relation to our budget position, we do feel we need to increase some of the staffing and some of the teams to manage some of that demand and the pressures. We've had a 17% increase in children looked after year on year. We've had a 100% increase in terms of SEND plans. So we recognise that we do need to put forward a strong case around increasing some of the staffing numbers. We support all of our staff to access all of the benefits that the local authority has, and we use all of those employee assistance programs to its full amount. I think that's what I would say. Obviously, we undertake risk assessments for all of our staff to ensure that we're looking after their health and well-being. Health well-being is a focus in all of our management meetings to ensure that we are doing the very best that we can to support our staff in doing a really good job. And while I say we've got challenges around recruitment, what we've been really successful is that those members of staff who no longer want to be in the safeguarding outcomes, because that's the front-facing, really, really challenging, a lot of those staff we've managed to retain within other parts of the children's services. In terms of what staff tell us in exit interviews, we do exit interviews. Some of it is the pressure of the work and it's the demand of the work. Not about the team, not about the council. They love working for the council. They love the practice model we've got. They like the reflective approach that we've got, and the collaboration across the whole of the service. But it is a demanding role. Thank you.
Are you going to come back again?
Yeah, I'm sorry.
I suppose it is your report that we're still discussing.
Yes, I know. I mean, all I would say is that because I'm new, I'm going out and meeting teams that work under Mary, just in a pleasant way to talk through with them what those pressures are, so that they can see, if you like, the face of the politician there, actually respecting the fact that they're working hard. And you can't wave a magic wand, but you can actually do what you can to actually make people feel wanted by the organisation.
Thank you very much, Paul. Kevin, and then... Actually, can I make a comment? Just on the back of what... as Chair, of course I can make a comment. on the back of what Leslie was also talking about, I think it's important to recognise that, council services don't sit in sort of isolation of everything else. So, real life impacts such as cost of living, high house prices, the lack of bus service, etc., have a huge impact on our ability to deliver services, because we might not then be able to attract, the necessary staff into those very necessary services as well. Now then.
And it can even be down to a simple thing like car parking.
It could be down to car parking, or it could be down to, try not to be too political here, but, just the lack of a bus service as well. Kevin?
Merely a point of comment, as I'm a representative of a professional association and hopefully an added value voice on the panel, but just to say that the stress, obviously, schools and education and the whole, I'm sure is the same in other public services, are under the tremendous stress and lack of resources, all told. And obviously, the higher the pressure on the central team, the higher the pressure on schools themselves, because obviously they are having the consequences of trying to work the best way possible, and we know they're all doing their best within these very, very tight confines. And hopefully that message, which is supposed to be apolitical to whoever's in charge, needs to get back. There needs to be proper resourcing of public services.
Thank you, Kevin. You have reminded me of something else that came up relatively recently, an announcement that schools were going to have an unexpected shortfall as well. And I don't think we've seen anything at this panel about the impact of that, but perhaps we could have that at our next meeting as well. Paul, did you put your hand up just now? Or? No. Okay. That's okay, then I will pass on to my Vice Chair.
I'll be very brief, because I think you've done a great session, Paul, nearly an hour or so, and thank you for your very full answers. It always worries me when I see budget efficiencies have been made, and you wonder what does that actually cover. But I'm reassured by what you have said, Paul, and Mary, in that what the reports we're going to read later on, especially the IRO and other reports like that, on our agenda today, is that the lack of resources, and that the officers are feeling that they really must have some more resources. So we probably will be looking at budget considerations in more detail maybe at our next meeting, but obviously this panel is relying on you, Paul, really to put the case forward for all the issues that are being raised by staff. But one issue I'd like to look at in particular, and I think the policy came about in this on this committee, and that's about free school meal vouchers during holiday time. And I know we have an agenda item on this, but I'd like to raise it now, Paul, just in case you have to go off early or something, is that the free school meal vouchers for those in receipt of free school meals during the holidays is due to end in Easter 2024. And I know it was something that Dina particularly pushed, and I think based on what we put forward, a policy I think it was we put forward here in our scrutiny panel. So it's a budget of 800,000, I believe, and I think it's one that really we as a council ought to be looking at, making sure that it is there for those young people who are in receipt of free school meals and who won't be getting anything without this during the school holidays. So my plea is, remember that. Thank you.
Liz, I'll definitely try to stay on for the rest of the meeting, and I'll listen to the presentation later on with great interest, and I take the point on board.
Thank you. Okay, so have we finished scrutinising our cabinet member for the time being? Don't worry, there'll be more opportunities. Okay, so now we move on to the BSW ICB report. Before we start, actually, can I make the same plea that I made previously, that this doesn't come with our standard, covering sort of report template. So for us, it's not absolutely clear what we're being asked to do. And so it'd be really useful for us to know, are we to just note, or are we to, are you asking us to consider some specific thing? But, it's always useful to have an update. And our default, I guess, would be to note an update. So is there anything you wanted to add to this report, and also to give us a steer on your expectations from us as a panel?
Yeah, thank you, Chair. I guess just for clarity, this item has always been an update report, and so hence the style in which it arrives to you is just written as an update report, perhaps with slides appended. If you would find it more helpful to do some sort of cover sheet, I'm happy to do that, or if you want me to take elements of your more formal report, then let's look at the template. And if I take that away and work that through with you, Mark, because obviously we want it to be as helpful to you as possible. I think really today it is just an update report. There are a number of updates on there. So 3 from an RUH perspective. There's a short update around the integrated care-based programme, which we have covered before, and also a winter update. So if helpful, I could give you the headlines on each of those. And then we were due to have an update on the community pharmacy item, but as I think we said at the top of the meeting, if we defer that to next time, and again, I can be mindful based on comments how we steer that and how we shape that. So the RUH updates then, the first one is around SULIS, and members will recall we gave an update around the SULIS elective orthopaedic centre previously. Just a short update to let you know that planning has now been submitted, so that is progressing. The second update was around the Dyson Cancer Centre, and again, work is continuing to build that centre to welcome patients in the spring of 24 rather than the end of this year, 2023. A shortage of engineers doing internal complex works is the reason for that. But when it's open, it will bring the majority of the RUH cancer services under one roof, including research. So there'll be a 22-bed inpatient ward as well as the Macmillan Wellbeing hub. And it will provide a very nurturing and therapeutic environment, focusing on land, water and sky theme. It's got local artists and designers involved. So this is really quite an incredible community scheme and a huge achievement. Now, yes, there was £40 million worth of national government funding under the new hospital programme, but really the community effort has been outstanding. So I'm pleased to say there's been a £4 million donation from the James Dyson Foundation, £1 million from the Medlock Charitable Trust, £1.5 million from Macmillan, and £5 million from RUHX. So just the kindness and compassion of those supporters is really incredible, and something that I'm sure we all recognise we're blessed with there. And then the other update from RUH is around their CQC inspection. The report was published in October 2023. And the inspectors had many positive things to say about the visit. Perhaps resonating with the conversation today, there was particular praise for the outstanding programme for international nurses and how managers and ward leaders were supported to make the wards a welcoming place to work. However, the report did reflect some areas that require more attention, and that resulted in the reduction of the rating of medical care services from good to requires improvement. Now, an action plan is already in place to address that, and that focuses on improving storage space on wards, consistent completion of fluid chart documentation, and a continued focus on healthcare support worker recruitment. Partners in the Integrated Care Alliance will, of course, continue to work to support that effort. And then, as I say, on the Integrated Community-Based Care Programme, we've covered that previously, just to let this panel know that the next stage of that process was the formal procurement, and that began in October, and as you would expect, that's following quite a strict legal and commissioning regime. So there's not much more of an update on that at this moment in time, but it's just to make you aware, Chair. And then finally, some good news on the winter update. I think I spoke last time and gave you some headlines there, and I'm pleased to say that the respiratory illness clinics, the push clinics that we were looking at for children and young people with the GP Federation, BEMS, that actually has secured funding. So I'm pleased to say, Chair, that will be 105 clinics that will run from December until March 31st. So that is really welcome and will make a real difference based on our experience last year. So I hope that's a whistle-stop tour, Chair, and happy to take your questions and comments.
Thank you very much, Laura. So, panel, were there any comments or points you wanted to raise on this? Kevin?
Yes, morning, Laura. There was a question that I raised last time, which you were very kindly going to find a little bit more about on the integrated care programme, about there was going to be an initial point of contact, somewhere where patients would go for triaging of services, and then they would know where they have to go. And I asked whether this might be the GP or whether you had somebody else in mind. Now, that ties in a little bit to the next little part, which is around the pharmacist bit, because it seemed from your update that there will be more independent prescribers, and how far that goes, and whether the underlying technology structure that you have in place is sufficient and robust enough to ensure that if I went to the pharmacist today with an issue and tomorrow went into hospital, would they know what it was about, and how I'm doing?
Yeah, and apologies, I don't have a full update today because that work is still ongoing and we're working through it, but the things that I referred to last time, and you're right, it's about how we get that care coordination right and seamless, so it's right the way across the pathway, and as you rightly describe, people may present in different places for different things, and it's making sure that they get the appropriate signposting and that seamless provision of service. So we do have a central care coordination approach that we're looking at through BSW, and that will cover all the place localities. We also currently have something of a more local service, our community wellbeing hub, which actually looks at the wider determinants of health, so not just health referrals. And we do need to look at how we make sure that those two things are seamless. The sort of technical issues that you raise are very live as well, and we do have digital work streams that are looking at this. So things like an integrated care record. So what can we do regarding primary care, for example, being able to understand what previous referrals may have happened, or if somebody's presenting in ED, how do we make sure that people have the right information? And obviously, as I'm sure you're aware, there'll be lots of considerations in that in terms of how we store and utilise people's information with consent. So we do have a piece of work that's looking at, I guess, a three-prong attack. So how are we doing care coordination across the entirety of BSW? How are we making sure that links into our local offers? And how are we making sure that we're backed up by the digital necessities that we'll need, things like System 1, things like integrated care records and Rivium, and the sorts of systems that we're looking at. So it's a live piece of work at the moment. I suggest when we bring back the community pharmacy piece, if we make sure that we have the angle in there from a primary care perspective, but it might be something that I put in a future update report as well as a broader piece, if that would be useful.
Thank you, and I think I'd like to just add an extra question into that, is how do you ensure those lines of communication outside the BSW area as well? Because not everybody will only present in a place within that region.
Yeah, absolutely, and the same principle, hence that integrated care record following you. But you know, at the heart of this, it is about that wraparound care to the individual and making sure that it's seamless for them, not being passed from pillar to post or anything getting missed. Yeah.
Thank you. And within that, I'd actually like to just add a particular category of person, which is students. Liz.
Firstly, many thanks for this report. I mean, ever since the Integrated Care Board took over the regularisation of pharmacies, I've been really keen to find out exactly what this means. So thank you for the update, and I know you're going to come with more detail later on. But I just wanted to know, how do you choose which pharmacy becomes a community pharmacy? And I'm delighted, I'm so narrow-minded, that Porton, my village, has a...
you haven't mentioned it yet.
No, has a community pharmacy. And obviously, increasingly, this is the first point of contact for residents with medical problems that they need to talk about. They don't go to the GP. They're encouraged to go to the pharmacy. So how are they chosen? I noticed there's an NHS sign on top of our pharmacy, recently changed hands. And will every area, because I looked at that map very carefully, will every area have a community-based pharmacy? It looked like every area would, but how do you choose if there are two pharmacies, for example in Lisbon Norton, how do you choose which one becomes a community pharmacy? And I'm just very pleased to see that this is taking place.
Thank you, Councillor Harbin. I think it would be better if I could take that question back to my colleague. I mean, the simple answer is obviously we would be looking at demand and capacity modelling and understanding the aspects of what are available in a particular area. But I think, I wouldn't want to misadvise the panel. So if it's okay, I'll take that back and get you a fuller answer. Thank you.
Joanna and then Leslie.
Hi, yes, thank you very much for your report. I'm very happy with what you said, and again, I would back you up with about students. That was the first thing that came into my head, is they are a group of people that are a law unto themselves in all kinds of ways, so how do we reach them? And it's a problem. I just want to pick up on my own attendance at the public policy exchange event, Eliminating Dental Deserts, and how, again, we can pick up on some of the points that they made. And actually, it does sort of pick up, too, on what Councillor May said about staff and issues around staffing. There's the shortage of NHS dentists is because a lot are retiring or going private. And one of the major issues is, and going back to students, is newly qualified dentists are now massively in student debt and can't afford to be NHS dentists because of the way the NHS dental system is run. So they're not becoming NHS dentists, they're just avoiding that altogether. And it also made me think about how is that an issue for the new group of people that are coming into social care work of all kinds and the wider picture. People are massively in debt when they leave college and are now thinking in very different ways. Is there some way as a council or as a pension fund holder that we actually say, okay, you come and work for us for 3-10 years and we'll pay the debt of your college fees, whatever. Are there different ways of us thinking? Clearly the NHS payment system was not fit for purpose, and the hours of working and lifestyle needed to change to fit different ways of educated dentists. And also the age of everybody is changing. In particular with dentists, they were talking about how there were more teeth now than there have ever been, because when this one dentist spoke, he said when he was a young man becoming a dentist, everybody over the age of 60 had dentures, whereas now everybody over the age of 60 doesn't. So there are literally more teeth to look after. Small point, but it's important. And it's those small points, isn't it, that become important. How do we look after more of what we have? There was an upstream oral care was not in place. And I picked that up too as a parent. I can't remember ever my children being taught about cleaning their teeth. And I remember always as a child, it was everywhere. We were always taught, weren't we? But there isn't the same advertising of how to look after your teeth in the same way anymore. So I think if maybe that's something for this panel, that we need to think about oral care for children.
What more we can do
to make sure that is taking place. Yes. And also that career pathways need review. But I'll stop there. Thank you.
It's okay, Paul Scott's going to give you an update. He might even give you a small tube of Colgate and possibly some disclosing tablets.
I may or may not be able to, because it is, one of my colleagues who leads on our kind of work with children would be able to do that more. But there is lots of work in early years settings and schools around oral health and looking after your teeth, as well as, and what you're eating, as well as brushing and so on. I think some of the work around brushing and giving out toothbrushes and those sort of things has changed, I think, a little bit, which has always historically happened, but looking at the effectiveness and the inequality of it, because we do have clear inequalities, and some more targeted work, I think, has been trying to happen as well. And we've just actually commissioned some work through our Inequalities Fund, from funding from the ICB, to work in particular with families whose children have autism or learning disability, where oral health can be a real issue and dental health is worse. And can be a really distressing thing for those young people to recognise that inequality as well. So there might have been a slight shift towards a more focused approach. But if you like, I could just get even just a written response about what actually universally is going on in schools at the moment, or early years.
I mean, coming out of a life with teenagers, that is a bracket that you just don't reach.
Yes.
So how do we reach that group of people that isn't the parent? They really need to be reached.
Yes, I'd love to know the answer to that. Personally
I think we would all like to know the answer to that one.
But if it's helpful, I can just give you, I can ask for a brief email response after the panel, just to what we're doing.
Thank you very much. Think of Leslie and then Kevin.
Yes, thank you for the report, Laura. It would be really helpful to have something in advance to have a look at. I was interested in what you were saying about the Wellbeing Hub. Can you explain a bit more about how that will work and where will it be sited? Thank you.
Yeah, certainly. So the Wellbeing Hub already exists, and I'd say it's one of our flagship things in Baines that makes such a significant difference to the joint partnership working. So my experience, what I have seen, I mean, we often focus a lot, don't we, on winter pressures and the acutes, but actually, if you see what has turned the dial in Baines, it has been that wraparound support and having things like the Community Wellbeing Hub. It's actually based in Peacedown, St John. Actually, it's close to Sulis on similar location. And so it's got a physical base there, but it's not a public-facing building other than when they have particular support groups in. But one of the key things that we did recently, for example, with some joint funding through the ICB, was to set up a hub-and-spoke model. So the Community Wellbeing Hub actually did an in-reach into the RUH, into the atrium, so that pretty much as soon as people are arriving, you're thinking about how you're planning for their discharge and what they might need in terms of support. The other thing that we find with the Community Wellbeing Hub, it's a partnership effort, so there are significant numbers of partners involved across our third sector. Quite often when somebody may present with an issue, we may find that there are a number of other complex factors that need to be addressed, and the Community Wellbeing Hub can be vital support for people in that situation where they can contact the Community Wellbeing Hub and then they can be put forward for other services that they may not have known existed. And that can offer them some real true support. So the types of partners that are involved include Age UK and Bath Mind, but many, many others. Obviously the local authority, obviously other health partners as well. So it's sorry, I can't sing the praises of it enough. It really is a flagship, I think, in Baines, and it's just really, really helped that joint working effort. And we've seen the results. It's demonstrable impact.
Thank you. Can I just come back on that? So this is for inpatients. It works for inpatients that are coming in?
Sorry, this is for everybody. It's not, sorry, I just used that as an example. The Community Wellbeing Hub is a community offer for everybody, and it can offer a range of support services. So, for example, when we had our Community Investment Fund, warm home grants, it might be, people might need food, but I'm just offering a practical example, is that when people are going into hospital, for example, they can also support with that discharge and support at home. But they do a range of things, wider determinants of health, which is why I think it's so successful. It's that wider wraparound support.
Thank you, and I'm happy to ask for perhaps a briefing on the Community Wellbeing Hub to be circulated. As Laura says, it's a fantastic initiative. It's, I think, the only one that exists in the country of a joint collaboration between what was a private entity, which was at that time Virgin Care, the council, and also health services as well. And health services in Virgin, but also 3SG as well. So there was 200, 300, maybe even 400 different agencies that are all or were associated with the Community Wellbeing Hub. So you could see how you had links to a range of different services, so you could offer something that's quite bespoke. And the other key factor there was you had it was a sort of a no wrong door, but one door as well. So you only had to tell your story the once, and then it would be triaged. And actually, that's where Rizian, is that the right word? Seems to me to be the only system that's able to talk to a range of different partners was set up, and this was one of the absolute fantastic positives that came out of COVID, the pandemic. It was that collaborative piece of work, and I'm personally very proud of it as well. So, yes, but we will get a briefing note circulated to everybody on that too. Okay, thank you. So, in all that excitement, I think, Kevin, you were next.
Thank you. Just to end that little discussion around teeth, I'm hoping that your comment on the mobile service, still waiting for feedback, and whether that might be helpful in early prevention, will maybe go into fruition and not head teachers supervising daily cleaning of teeth, which is an idea I hope that everybody's dropped quite quickly by now. My question really is around the medical care services RI, and whether you feel you have sufficient resources to address that and put it where you want to be.
Yeah, as I was saying, the action plan is already in place, so we're fully assured that those issues that have been raised, are in hand and are being addressed. And I think it's the 3 areas that are highlighted in the report. So yes, we're confident and assured that is taking place.
Thank you. With respect to the future work on dentistry, could we have some figures, please, on dental extractions in the under-19s?
I'll have to take that back to colleagues and see if that's available. I'm sure we can do something along those lines. Yeah.
But I think the overriding message, though, David, is that there are more teeth.
Yes, but not necessarily in the under-18s, and we have seen quite a large rise in dental extractions over the last few years. Okay, there was a rise partly related to pandemic and people not whatever, but there's been a consistent trend.
Thank you. I think we will have a piece perhaps devoted to dentistry, and I would hope you'll be able to add your comments from the seminar that you went to. Thank you. Okay. Apart from the Cabinet member, is there any more that we want to add to this item?
Chairman, can I just, I know at the Cabinet last week the issue came up around the Health and Wellbeing Hub and the funding for that. So I think there's probably some sense in getting Councillor Bourne at a future meeting to make sure she picks that up as well, because it is...
Are we talking about the same thing? You said the Health and Wellbeing Hub, or are we talking about the Community Wellbeing Hub?
Yes, Community Wellbeing Hub, yes. Okay. So I think there's an issue there to make sure we pick up another committee meeting of yours. And, great credit to you for everything you did on that. No, I mean, seriously, it was a major initiative, and, we worked with partners, but it was really good.
And it still is, yes. So I think we'll be slightly, more than disappointed if anything happened to reduce its effectiveness. I think we're finished with this item. I think you wanted us to note and to comment, so I believe we have sufficiently commented, and actually, there was one more thing I wanted just to add, which is the difference between councillors and councillors, which is something I picked up in Appendix 1, answers to questions asked by councillors with the other sort.
Noted. Thank you.
Okay, so the next paper is on... It's on the IRO, the Independent Reviewing Officer's Annual Report, and we are asked to note this paper and to recognise and value the impact of the IRO role. So, Paul, can you assume that we have read this paper, but we will... is there anything in addition you wanted to add? Thank you very much, Paul and Laura, to this before I open it up for questions and comments.
Surprisingly, no, Chair. The point is this is a statutory responsibility, and it's our responsibility to the young people that we look after. So I think it's a really good report. Thank you, Chair.
Thank you. Chris.
Thank you, Chair. I just wanted to acknowledge that neither the wonderful Sarah Hogan is here, who is currently on maternity leave, and she is the service manager for the Independent Reviewing Officer. neither is a maternity cover, who is Michelle McKay, who came in place to deliver the service in Sarah's during Sarah's maternity. Michelle McKay is an army reservist, amongst other things, and she was called up for mandatory training this week. So neither are here, but I am. So I will try and assist with questions about the report as much as I am able.
Thank you very much, Chris. Okay, so panel, do we have any comments or?
Do we to praise the report a little bit? Would that be?
Yes, but just very, very, very short. Yes.
Right. Okie dokie. Just to remind people that the Independent Reviewing Officer Service sits separately from Children's Social Care, which sits under Lee Zyvek, with both myself and Lee reporting to Mary as the DCS. And that's an arrangement that we've had in Baines for as long as I can remember, so that we've got some offline quality assurance of some of the practice in social care, particularly around children in care. So that's why it sits in my area. It has been a challenging year for the service. When you look through the report, you'll see that some of our timeliness has been affected. I just wanted to reassure people that this year we're seeing a significant improvement in some of that performance as well, which is really pleasing to see. We have had a 17% increase in children coming to care during this period, and more children staying into care than leaving. We are facing, like most children's services, challenges with resourcing the service, and in this year's budget we have made a request for one more independent reviewing officers, and that's just on the basis of the numbers of children that we have to support. There haven't been any significant changes in our demographics around the children in care that are coming in. There's still more boys than children, but we are seeing an increase in the age range of the numbers of children that we're coming into care, but that's predominantly driven by the increase in numbers of US children who we tend to be older, 15, 16, 17, who we accommodate. We have an ongoing challenge around placements, which around sufficiency, which Mary talked about earlier, but there is a need still for us to place out of area. But often out of area can mean in one of our neighbouring local authorities, so it doesn't always mean a long distance. But we do have to travel further, particularly for US children who tend to want to be located in larger cities, perhaps with people they may know, or communities they feel they're more connected with, and that places additional strain and pressure on the reviewing service in terms of its capacity. Whilst the IRO service and the social workers work closely together, we do have a role to be able to challenge and scrutinise the plans that we make for children and young people in Baines. I'm pleased to say that we have a very positive relationship with the social workers and the managers. We respect each other's professional boundaries and respect the pressures that both the IRO service and social work teams face. And when we do challenge social work practice, or we challenge timeliness of a piece of work we don't think is moving quick enough for a young person, it is done with the ultimate respect that we both want the right thing, we just want it doing to the best outcome as we can. We're moving to a more formalised way of recording dispute resolution, so it will now be recorded on the child's file, whereas before it was on a tracker. And also, I think one of the things that me and Mary were talking about when we were reading the report this year, and I have to recognise the report this year was written by an author who's the first time doing this, but very, very capable, experienced social worker, is what we'd like to try and do, make sure we get into the new report, is start to pull out that really good practice that we're observing, so that we can really give a scrutiny, not just a sense of what does our child in care population look like, what do our plans look like, what was our performance like, but to start to give a more of a flavour of some of the good practice that we know is happening in, which the IROs are observing through some of the, what I think is really innovative practice in social care that's happening at the moment. We want to do more around the child's voice, and those of you who have been here before will know that's been in previous reports, and it remains an outstanding challenge for us at the moment. I'll leave it there. Hope that was short enough, Dina.
Thank you very much, Chris. So, panel, any questions, David?
Thank you. I just wanted to ask about the increase in children being placed in provision out of local authority. and a considerable distance from their birth parents or corporate parent, and reasons for that. Is the council doing enough? What can the council do?
Well, I think Mary will probably answer. It probably sits about a bit between both of us, really. The IRO service don't make those placements. The IRO service is responsible for making sure that the placements are suitable and that the plans which are in place whilst they're there are in the best interests of us as corporate parents in the role that we've got. But I do know from talking to my commissioning colleagues that we're acutely aware of where we make a placement that is at distance. It's not ideal by a long shot, by a long chalk. It places lots of pressures not just on the IRO service but on the social workers as well. Tends to be where we don't have the provision, so it could be a residential children's home or residential school, which we are blessed with lots of those around us. We are starting to look at plans about how we develop more provision in-house to try and tackle that, and I'll pass over to Mary at this stage.
Thank you. Sufficiency is always an area that we're looking at in terms of sufficiency, be that in-house foster carers, independent fostering agencies and or residential. On an annual basis, the local authority completes what's called a sufficiency statement. I know the Commissioner Lead is currently working on that. And the areas that we increasingly need more placements for is, as Chris has mentioned, in terms of the profile of young people. Younger children we can generally place within in-house foster carers, but it's those more complex adolescents who are presenting with more complex needs that we sometimes struggle to have sufficiency locally. So a couple of things we're trying to do again in terms of the supported lodgings, have them come in now to the family placement team. Our family placement team are the team that looks at recruiting, supporting and training foster carers. They will also now have a remit around supported lodgings. Ofsted have moved to all post-16 provision becoming regulated from October this year. So again, I think that will give us a really good opportunity to explore how we can increase that sufficiency by moving it into the family placement team. We are working regionally and we are part of the DFE bid looking at increasing sufficiency across the Southwest because it is a real challenge in the Southwest. We are competing with our colleagues in other local authorities for sufficiency of placements that are available. And while our commissioning team would really love to have a variety of offers in terms of availability of placements, sometimes that's just not the case, and we have to go for what's immediately available. So we are acutely aware. Our aspiration is always, we've extended the work we do around supporting our connected carers, and our first port of contact is always to try and place within an extended family or connected carers, and our support around connected carers is really, really positive. So we are always looking at what more we can do around sufficiency. There will always be some children who may need to be placed at a distance, but as Chris has mentioned in the IRO paper, the pressure on distance and travel for some of those placements is certainly adding to the workload of our staff. So we are working within the local authority and across the region about what more we can do about sufficiency. And there is some DFE funding coming through around, a regional approach around fostering that Councillor May and I discussed because it might benefit us or it may not benefit us. And what we have seen is that the development of the regional adoption agency has benefited us. There is some discussion underway of the DFE around regional approach to developing more resources. But again, we've just got some seed funding from the DFE to explore that over the next year. So we're doing lots at a local and at a regional and a national level around sufficiency because we know it's a real challenge for us. Thank you.
Thank you, David. I think it was Kevin and then Paul. Was it Paul first? Thank you.
Okay, I don't mind going first, second or third, it's not a problem to me. I've got one question and a couple of paragraphs I'd like to drill down a bit more because I don't really understand them. It's a new area to me. The simple question is, children who leave our care, in this country there's a large number of people of all ages that just disappear. So when children leave our care, can we be assured that none of them have disappeared, we know where they all go, And have we ever had any disappearances from our care?
So as part of the care planning regulations, up until 2022, the local authority had a duty to support care leavers up to the age of 21. That changed in 2022. That duty is now extended up to 25. So as a local authority, we have a responsibility to ensure that we have an opt-in as opposed to an opt-out in terms of maintaining contact with all of our care leavers. I'm really pleased to say we're in touch with all of our care leavers.
Oh, fantastic. Well done. That's a good report, by the way. Right, now, the bit that I don't really understand how it works is paragraph 9 on asylum kids. So a lot of these are going to be completely traumatised young people. They'll be on the road for a number of reasons. So what I want to understand is, surely if they're a traumatised young person, why would they be placed with us if they want to be placed with their friends? Because it would seem to me that if you're a traumatised person and you don't have any relatives here, the best way to help you through that would be to be placed with your friends. So why are young people being placed with us when they'd rather be placed elsewhere? How does that process work?
It's a really good question. So how the National Dispersal Scheme works, we've got what's called a voluntary National Dispersal Scheme that the Home Office operates through South West Councils. So in our particular instance in the South West, it's through South West Councils, and we are allocated young people in that route. We have challenged for some young people who have relatives in a different part of the country that they should be placed there, and that has happened. We've managed to get them placed in a locale where they've got connections, but we retain corporate parenting responsibilities. What we've not been able to do is transfer those to that local authority where they could be accommodated. It's the nature of the dispersal scheme.
But surely the government funding goes with the child. So if we put someone with a family up, surely then they just move the funding. Why should that be dependent on us still? Why does the funding not go with the child? So wherever the child ends up is where the funding goes.
Chair, I think we're going into politics. I mean, the simple fact is that the government have got a major problem with unaccompanied asylum-seeking children, and they just came up with a formula of the 0.1% allocation out to the local authorities, which I mentioned earlier on. And, if that child lives in London, then we're having to send social workers up to London, or we employ a social worker up in London. So it's a real issue because the cost is the government's interpretation of the cost, and it isn't the real cost that we're picking up, which is one of the reasons why we're overspending. And it's happening elsewhere as well. I mean, it's not just us, but the simple fact is some local authorities aren't taking their allocation, which is why we're now saying, let's just stand back and think about how we deal with this most effectively. Because these youngsters, as you quite rightly highlighted, they've got problems. But the problem that we've got is if they then stay in after 18, then we pick up another responsibility, which is quite right, but the simple fact is there's a real gap between the funding. So it's a political question you've asked, Paul, really more than a technical.
I don't mean it political.
No, I know, but the simple fact is one local authority, Kent, tried to cut down the support they were giving to the budget that they were allocated, and the High Court decided that Kent were wrong, and rightly so, really. The simple fact is these are youngsters, they've got to be looked after correctly and properly.
Yeah, I've got no problem with them being looked after. I just don't understand why they're not looked after where they want to be. Why are they allocated to somewhere at the other end of the country when their family or relatives are somewhere else? So that's something I think you need to take up with this government and the next government when it comes in.
The Liberal Democrat government.
There's pigs flying.
Definitely, it's a well-known flaw in the system, Paul.
Yeah.
And it's recognised by the LGA as well as local councils.
Yeah, so I would like that to be continue in focus because it concerns me quite rightly that we don't seem to be looking after these traumatised people in an anywhere near adequate approach if we're responsible for them in their wrong places and they've got family elsewhere. It just seems to be nonsense to me. Right, my next question is about 14.1. Sorry, that's the last one. If I just get back up to 14.1, which is your areas for development within the IRO. The second one, it seems to have not progressed since 2019. What is the reason for that? Is that a budget problem from us as a council, or is there a different problem, or is there a complex issue? But to have not, it's outstanding since 2019, I would have said is something that we should be addressing, or challenging, or asking what is the reason for it outstanding since 2019.
Sorry, Paul, can you clarify which...
14.1, the second block about areas for development improvement.
I think this relates to life story work, which is a piece of work that has been outstanding for a while. Mary, do you want me to...
And the one above it, feedback from children as well. So, it's, why have we got things outstanding from 2019 is the question.
Yep. As we talked about in terms of the feedback, we do get lots of feedback from young people, and if you look at the previous report, you'll see that we always try and make sure the child is able to attend the review, or is able to express their opinions before the review if they don't wish to attend, which is their right. What we've wanted to do is find a, and we always ask for every parent and for every child who attends the review to provide feedback by a form as well after the review and give that to us, and we do achieve that. What we want to do is get a lot more depth and research into that feedback so we know how we can better deliver those services. I think, Paul, I think some of the issues have mainly related to the capacity within the service at any given time. There's not a lot of room for doing development. Having managed that service manager over the last 3 years, and we've done a lot of work to try and reduce that person's workload. The person also is responsible for child protection, convening child protection meetings and child protection conferences, and the local authority designated officer, so the LADO role as well. When you combine those 3 areas of responsibility in one service manager, what you don't get is a lot of room for doing development work. So that would be my main explanation of why that piece of work is left undeveloped. We have participated alongside our social care colleagues in making sure that we explore other initiatives around making sure we're capturing the child's voice. And we are pleased to say that in this report we're able to see a lot more evidence of that in some of the social work reports which are coming through. And that's down to the work around the voice box, I think it's called, which is a piece of work that Children's Social Care have been doing. But we leave it on there each year, knowing that it's overdue, because we want to remind ourselves and challenge ourselves we want to do that work. We are doing what we should be doing, we just want to do it better, so we've got more better quality feedback to inform the development of the service.
And my final question, if I can, Chair?
Do you want to do the second bit, which is the life story?
So the life story work is how we work with children and young people in care to understand their journey through care. And there's been a lot of developments the last couple of years in terms of how reports are written, how the IRO actual report, the review is written to the child or young person. So there's been, while it's still in there as an area for development, that's not saying there hasn't been some progress in development, but we would like to have more time for all of our children in care to really understand the whole journey through care as they come out of it. So it is still a priority for us, and I suspect it will remain on there this time next year. But it's not that nothing has been done, but there is more we need to do. And equally, with the increase in number of children we've got coming into care, having the capacity to do that is really important.
In that case, I think you need to add something in about the positive side into that report so that people can see something's happening and moving on, not just leave it empty, because that's what goes out. And my final point is targets. I've raised targets before. If the target is unrealistic, why do we have it as the aspiration? If 85% is completely unrealistic, and 85% is quite clear that we're only at 46%, why is the target not 46?
Paul, is your microphone on? Is your microphone on?
Sorry. So the final bit is a point I've raised before in this panel about unrealistic targets. I would rather have a realistic target we can go for, and then we can challenge and look into the budget process about how we move it up. There's no point in having an 85% target which we've got no chance of meeting. Let's have a 46% target, and then let's have the pressure on us to raise it up to 56. But why have 85 if you've got no chance of meeting it and we're at 46? I would rather be progressing our targets rather than sort of having reports that come back and saying this is just absolutely hopeless, because it looks bad on us. Why are we setting ourselves up for something that we simply can't deliver? It raises aspirations, it raises expectations, and it's a false promise. In my view, 85 with 46 delivery.
Thank you, Paul. I think that's a fair comment. I think the dissemination of records is the end of a process. So you wait for a review to be completed in time. You get the report, and then you need to get the feedback from the social worker and the RIO to get that report out. So it's a complicated process that leads up to eventually those minutes going out. And yes, I agree. Should we stop setting ourselves targets? Maybe 85% is too high at the moment, but I think we need to certainly improve from 46%. So we do need a focus on improvement around that particular area. We have had some issues, particularly around minute taking in the administration side of the IRO service this year. And it's a conversation I'll have with Mary about whether we think that 85% is the right target or not, but I certainly need some way of making sure that we're telling you as corporate parents that we need to do better in that area.
And perhaps that's an issue we can pick up actually in corporate parenting as well.
Chair, yes, this report will be put to the next corporate parent meeting, so there'll be scrutiny there, and as apart from a couple of people in the room, we're all corporate parents, then hopefully we'll have a good attendance and we'll be able to raise those questions again.
Yes, we'll definitely be able to interrogate it even more then. Okay. Thank you, Paul, and thank you, Chris, for your answers. Kevin.
Thank you. Yeah, most of my questions have been taken, but that's great. Just two quick things left round. One, the same improvement table on page 51. Just wondered if the sufficiency of placements is an issue that it's not on the development area, or is it in there and I've missed it within other wording?
The sufficiency of placements duty sits with children's social care. It doesn't sit with the IRO service.
Well, that's a good reason.
Yeah.
And secondly, do the IROs have any inputs regarding children in care and reoffending? As we had a look at the serious violence group the other time, and there was a high proportion of looked after children in that reoffending bracket.
Yeah. So the IROs will review all children in care. They don't review children who are not in care.
Sorry. So on the thing where there's reoffending happening and there's still classes looked after children, the IROs wouldn't be involved with that?
Oh, they would be. If they're a looked after child, the IROs would be involved.
Okay. So what sort of role would they play in that sort of area?
I think Mary just, I didn't catch it quite. I didn't catch the nuance at the beginning of your question as well, but I'm with you now. Certainly, any children who's having a review of their plan whilst they're in our care, any external plans which might involve trying to reduce offending or involvement from other services, we'd look to make sure that the plan also encompassed activity to reduce offending or reoffending. So the IRO's role would be to scrutinise what is coming forward in that plan, not necessarily develop that plan itself before it becomes the actual review. But there would be input in from other parts of the service. So if that child is known to the youth offending team, then there would be specific activity that might be put in place to ensure that they're reducing offending, and that would impact on that child's placement as well. So the IRO would need to have the overall picture so that we're able to comment and scrutinise effectively that plan, and that would need to combine other activity from other services within the council. So just as important, as if that child is in the youth justice system, equally important that the IRO is aware of that and that they're fully involved in the development of the plan which supports that child in their placement.
So it wouldn't come under any of the statutory headings in the report at all?
I don't know. It's a good question. Do you mean in this report? Or
yes, in the annual report at all. It wouldn't.
I don't think we've captured that information before, actually. So that's a good challenge. But we haven't certainly presented that in the IRO report before. But we can certainly look at that.
Are you done, Phil? Okay. I didn't want to bring in someone else. Leslie, I think you're next.
Thank you. I've gone through the report and I noticed that the cover report talks about an equality impact assessment that was completed in 2020, but I don't get any sense in the report of any actions taken from that equality impact assessment. It doesn't have a review date, which is not very helpful, but I would like to ask for a report on those actions that are set out within that equality impact assessment, because it talks about things like increasing monitoring around disabled children, although it uses the wrong language. And as Paul said earlier on, Councillor May said, you know, we are in a very non-black area, and yet with looked after children, they're very much overrepresented. But I don't see anything in the report that says anything about that or how that's going to change. And the other thing it does is counter to the pledge that has just been agreed. It says there's not going to consider lesbian, gay, bisexual children or those with a religion and belief, which would seem to be a bit of an omission. So I would ask that we have a report on it to see what's happened, because I suspect that things have happened, but they've just not been included in the report. Thank you.
Yeah, thank you for that. I can ask Michelle to make sure that we update the equality impact assessment to make sure it reflects on the comments we've just received.
Thank you. Paul?
Just around the pledge, I mean, that was negotiated or discussed with the children themselves, and Councillor Mansell's proposal around the council meeting was very, very effective, but obviously from the children's point of view, they hadn't actually picked up that point, so I think it's good that you keep picking up the equality issues, because when you've got a predominantly white middle-class community, the disadvantage for those people who are either not within the middle class but also not white can be even worse. So I think it is an issue that we need to keep that pressure on all the time. And can I just say, around the corporate parenting side, I think there's lots of things that we can do to change that as we move forward, because quite clearly there's a lot of thought now coming from the government towards corporate parenting, and we're having lots of discussions with our team to see how we can actually change things, perhaps even widen or change the nature of the corporate parenting meeting and things like that, so that we can actually do more for our children. So the operational side is there, and that we'll be bringing back. But I think quite clearly this is somebody standing back and saying, how have you done? So I think that's the point. They're not actually doing it. We're the ones that are doing it. But it's right and proper that we have that independent report, which you're scrutinising today. But it will be going to the corporate parenting meeting.
Thank you, Paul, and thank you, Leslie, for your comment.
Can I just come back? I mean, the pledge is quite interesting because there was something in there that was quite broad around equalities. And it was interesting that when we met with some of the young people at the meeting, that they weren't in the slight bit phased when we said we put in lesbian, gay, bisexual. That's something that young people sort of expect nowadays. They expect that to be picked up. But the other thing was around the feedback. So at that meeting, they'd made various requests, and this report talks about feedback and improving the feedback. And that's okay if we get the feedback, but what's the action then on the feedback? And I think for young people, they come into a room with a group of people, they've got no idea who they are, we're nowhere near their age group whatsoever, and they're all sitting there thinking, you know, what are we doing here? But also they want to know what we're doing in return for them coming to us. And I know I did make a suggestion that rather than having them one meeting a year, they have representatives come to all of them really, so they could make comments and and get more used to the whole process, because it is a whole confidence thing, isn't it? And I think for young people, either in care or leaving care, that's a huge issue, which we need to take on board. So again, I'd ask, what are we doing to make sure that feedback is enacted on where we can act on it? Thank you.
Thank you. Those are all really good points. And if you remember, I actually quite clearly supported that proposal that you raised at the council meeting. And also I'm in discussion with Liz about the issue about the protected status for children in care, because there are issues. It affects everything else that we do as a council for those children. So that's something that we'll be bringing forward as soon as we can get it into the bureaucracy.
Good luck with that, Paul. Liz.
Thank you very much, Paul, for saying that, and for Leslie for your questions on this. And I'm sure it's something that corporate parents will be looking at. My question is that part of this report, we're asked to note the pressures on the IRO service, and it's really been a challenging year, hasn't it? And in a way, I'm sorry that Michelle isn't here, because obviously she had a huge job to take over very quickly that the previous manager left very suddenly. We hope she's okay because of having to go on maternity leave. But there is a request for more money in this year's budget, and having learned that our budget is overspent by 6.5 million, there's a request by Michelle on behalf of the IRO service for an additional post, more money. There's been a 17% increase in children in care and double the numbers of unaccompanied asylum-seeking children, which we've discussed and talked about. So with this, bearing this in mind, there are obviously going to be budget constraints, and if the requests for an increase in budget, if these are not met because of the constraints, what do you think the impact is going to be on our young people, bearing in mind everything that's been said in the report about timelessness, etc.?
Just to pick up your first point, Sarah's very well, and during I saw her a couple of, about a month and a half ago with the twins. So yeah, she's well. Just to reassure her on that one. It's right that service managers raise the pressures in the area. They're really challenging conversations, as Paul said earlier. When budget is given in one place, it has to be taken away from somewhere else. This is a statutory responsibility. It's work that we, as corporate parents, we need to take seriously. And it has gone into as a request into next year's budget, which, as we know, is yet to be finalised and set, and it will be discussed there. The impact would be, if we didn't have that, would mean that we'd have to increase the caseloads of the staff that are currently within the service. That may impact upon the ability for them to provide the quality or the timeliness they would like. May impact on their feelings about how they work within the authority, and it may impact upon the way we're able to allocate children and young people. We certainly would advocate that we feel that this post is necessary. We feel that the numbers in terms of the caseloads of children, and if you look at the numbers of children and young people should be on the IRO's caseloads, we think it just works. It does work out in terms of what we need. I think it would perhaps affect our ability to be as present as we want to be in some of our plans. So we know that some young people are placed at distance. We always try and make sure we're there in person. If we haven't got the same resource to allocate, we may have to only be able to have a presence either virtually, if you like, which wouldn't be of our preference. But we're not there yet. We would, we put the request in the budget, and we hope that the service is supported.
Okay. Thank you. Right, I think we're finished with this report, so thank you very much for all of your answers and taking on quite a lot of additional jobs to do following this. Okay, so our next item is the, another lengthy title, Bath and North East Somerset Community Safety and Safeguarding Partnership Annual Report. So Paul, do you have any opening comments? And then I'll turn obviously to the officers.
Right, thank you, Chair. All I'll say is I was honest at the start of my report saying about the pressures, and then, further down the line, you see those pressures actually emerging. And I think this report quite clearly shows how those pressures are there. And, I was listening to what Chris said about the answer to your question around the budgets. I've got to try and argue the case everywhere I can, because it's not just the impact that's having on our staff, but it's also the impact it's having on the people, the young children we're caring about. So I think this is a very fair, really effective report, and Sarah is going to present it in a second. Thank you, Chair.
Thank you very much. Mary, did you want to come in, or shall we turn straight to Sarah? Where are you then, Paul? Sorry, I thought you're... Oh, well, we'll do that. My apologies. I actually put your words into a completely different context as well, so that's fine. Let's concentrate on this item, which is the annual report from the BCSSP.
Yeah, Safeguarding Partnership.
That one, yeah. Yes. Okay.
Sorry, I'll start again then, Chair. Sorry. I was jumping down the agenda, my excitement. Just to say, this has gone to the Health and Wellbeing Board. It's a formal report that went to the Health and Wellbeing Board, so they've considered it. And they've also, the partnership body, the strategic partnership body, has has looked at it with some detail as well. So this is the stage that we're at the moment now, is to pick up any further points today. Thank you, Chair.
Thank you. So, Mary, are you also going to talk about this report?
I'm just going to, what I was going to say, unfortunately, the independent chair, Fiona Field, is unable to be with us today. Fiona has shared a short number of slides that I'm happy to speak to or take any questions about the report back to Fiona. So I'm happy to just give a bit of an overview in terms of a set of slides that are present, or if those want to be submitted as part of the record of today's meeting, I'll be advised by yourself, Chair.
Well, in the interest of time, I think perhaps we could dispense with the slides for now, but it may be we'll need to refer to them in the questions that arise. So can I turn now to the panel, if there are any comments or points that want to be raised here. I did put in a comment previously where I think recommendations were referred to, but there was no list of those recommendations. And so this is partly my fault that I didn't come back on exactly which bit I was referring to, but perhaps Mary, you'll be able to answer that in due course, because the report obviously is nice and succinct, well, lengthy but succinct, but obviously when you refer to recommendations that have been made, it's useful to have what were those recommendations, so we can see whether or not they are being whether or not then the work that's planned meets what is being asked. So, Paul, then Kevin.
Thank you very much. So I'd like to ask a couple of questions on 10.3, the Avon and Somerset constabulary data. And so before I ask my questions, can I first of all say I'd like to endorse the fact that all our staff and the work we do is top quality, top class. I just want it to be better. So in 10.3, in answer to your previous question about missing children, you said there were none. That doesn't seem to quite tie in with the facts that we got in 10.3 with missing children from Bath and North East Somerset. So is that because you're counting them differently? So in the first one, you're talking about people who've just disappeared completely and lost. But in this one, we're reporting about people who come and go and whatever. But there does seem to be some sort of discrepancy in that. So I wonder if you could just address that challenge for me. But then the one that I'm really concerned about, which is a small number, But if it's a small number, if we stop it now, then we don't want to get it going. Because I'm absolutely, there's no place for any form of race hate or diversity hatred in this community. And it's gone up, not much, but 21 to 28. So does that flash, is that a figure that raises concerns and you think we must do something about that? Because for me, that would be a priority. Stamping out race hate before it takes a hold is easier than trying to solve these problems once they've got into people's things. So I'm very concerned about that one, those 2 points on those two tables in 10.3.
Yeah, so if I may, Councillor Crossley, in terms of the discrepancy, so in terms of the earlier conversation around our care leavers, we don't have any care leavers that are missing. This data refers to children under 18. So we do have occasions when children in care do leave placement and are technically called what's missing, and some of those young people are young people who go more than once or twice. We do know who those young people are, and we offer return home interviews for all young people who go missing. So we are aware where all of those children are, so there's no children unaccounted for, but there are children in care who at times do go missing. We have a system in place that, in terms of our approach around children going missing, that our youth offending service will undertake the interviews for children who are not known to social care. But if the children are known to social care, then the team or the children in care team will undertake those return home interviews. We changed our process this year because we didn't feel our previous process was as robust. So we do know where all our children are. Some of them do go missing, and then some of those are more vulnerable children that we'd be quite concerned about. And the service and the teams work really, really hard to locate those children and have them in safe placements. On your second point, in terms of the hate crime, I can't speak to all of the information in terms of the police's data, but we work very closely with SARI, who are a Bristol-based organisation, around any incidents that we've got around any concerns around hate crime or inappropriate use of language with young people. So I can't comment on the Hate Crime Committee. I don't sit on that, I'm afraid. I don't know, Councillor Romero, if you're able to add to that. But we would take any incidents of any notification around any hate crime very seriously. There's a lot of work being done with schools in terms of if there's any reporting or any incidents, and we work closely with schools around notifying us of any incidents and how we can support. But I can't speak to the specifics of this police data, I'm afraid. I don't have that information to hand.
And that might be something we can ask a direct question of our police colleagues on. And actually, I used to sit on that particular panel. I don't know if I'm still expected to be on it, so that's another question I need to ask too. But I'm sure a note is being made of that question to be asked of the police.
Thank you.
Thank you, Mary, and thank you, Paul, for your questions.
Thank you. Just on the last point, I've just wondered out of interest whether, because I know as a school head we filled in those notification forms of racial abuses and things, whether those incidents have risen and whether that backs up anything else or whether that's further down the line.
So it's the SARAF reporting?
So yes. It's not my question, but just on the last note there.
Chris, do you want to?
I don't know is the honest answer in terms of whether they've increased. We've certainly done a lot more work to promote that work in schools, because we want schools to report. We want head teachers to feel they're able to. We want teachers to be able to make sure they come forward and tell us about that. So we wouldn't necessarily always see an increase in the reporting as a negative thing, depending on the context and the circumstances. We may see perhaps a school, if it was a large secondary school, where there are very few reports coming in, but equivalent schools making lots of reports, we might think it's an under-reporting. So we want to be told about those ones, because our response to those can be quite positive. So we can offer advice and support and information around what they can do. We can provide some education and training through our team. And we've now got a race quality charter for schools, which we support as a council, and we think we've got 58 of our schools signed up to at the moment, which then allows teachers to gain more access to CPD and support and information about how to manage that. So, but the exact data I don't have in front of me, but I can look at that.
Excuse me. As I said, Chair, that wasn't my question, but Paul, I know, put his hand up. Did he want to just go back on that one point, Paul, or something different? Okay, sorry. My one is probably an old chestnut, Mary, around Operation Encompass. As the partnership still has a great focus on domestic abuse, is this now finally up and running as it should be? Thank you very much. That's a very quick and easy one, isn't it? Going on that same sort of thread, there were two things. One was around similar area, domestic homicide reviews, and that there were no referrals in that reporting year. And there were two things connected. One was that in the last report, there was something raised that the police weren't using the LADO correctly, and there was going to be some training there to see how that reporting mechanism might be further strengthened or whatever. And just wondered what had happened as a result of that. Equally, sorry, the other one doesn't apply now because Operation Compass is, so that's good news. But it's around the impact of safeguarding generally. And I note that it says that there's been a new, I've been on the receiving end, I suppose, of supporting colleagues on the safeguarding decisions and the process in school. And I just wondered that have the new managing allegation protocols reviewed the way in which this affects staff in schools and how that might have been affected or gone around in training of how information is handled, how investigations are created and decisions made in that whole process, because it can be totally devastating and career changing for school staff.
I'll pick up the first one and then I'll hand over to Chris if I may, Kevin. In terms of homicide reviews, it is accurate. We've not had any homicide reviews in that reporting period, 22-23, and I can confirm we've not had any homicide reviews in the current reporting period either. We have had a combination of child safeguarding practice reviews and also adult SARS, so in terms of children and adults, but there hasn't been a homicide review. In terms of the LADO reporting and managing allegations in school, if I may, I'll hand over to you, Chris, to cover both of those because the LADO sits within Chris's. Thank you.
Thank you, Kevin. I think your first question was about uptake of training and reporting from the police. Yes. Yeah, which is one of the things which Sarah had identified as saying actually we haven't got any referrals in from the police, and why is that? Or we have very few. I don't know the exact data, and I don't know what that data looks like now, but I know that there has been multi-agency training offered, and the police have been invited to attend that, and the role of the LADO. So I will need to ask the LADO specifically on that information. That's not a problem. In relation to support and training for schools, one of the things that we've done within the service area, and this is to support my comment earlier about how busy that role is, that head of service with IRO, CP chair and LADO, is we've now got a dedicated independent LADO within Baines. It used to be a function of the CP IRO chair. We now have a dedicated LADO, works for the LA 4 days a week, and then on the days that she's not there, there's some support from IROs and from the service manager. And part of the reason we wanted to do that was to make sure that there was more time for the LADO service and the local authority to disseminate learning and practice about what comes out of that. And I know that this year the LADO has specifically done training for CP leads and for schools around the LADO process and what we've learned through that. We could always do more, but I would need to check, but I believe there is now regular training offered on the role and function of the LADO for all school staff. And we also have we've set up a specific education reference group as part of the BCSSP where we have representatives from special primary and secondary feeding in towards issues around safeguarding, but also a place where the LADO can also go in and meet with that group. And then we have a number of networks, including the CP chairs, who aren't always responsible for LADO. It could be anyone in the school. If the head well, it would be the head teacher, unless it's the head teacher at the centre of the allegation. And we're always keen to make sure that where we can is we give particularly those organisations as much information as we can, because we do appreciate how sensitive and challenging, time-consuming, and ultimately possibly devastating that overseeing a LADO matter can be. So we have had a better offer, I would say, since we've been able to have that dedicated officer in the team.
Can I just follow up by just saying that I can, when you say training offered to schools, presumably that's about how the system operates, but I just wondered, actually, has there been a review of what the system actually is and the processes involved once an allegation may have come in from somewhere, whether it's an NSPCC or from the school or from somewhere else, about how those decisions are then made, who's involved and how initial information is gathered before the nuclear bomb is gone and everything then chain reacts downwards. Because that initial period there seems to be crucial in terms of what then happens. How that information, who can participate in that information, sharing, gathering, input, before then suddenly it just becomes another animal.
Have we had to review the process about how it's managed internally?
Yes. So that system of when that first decision, when the information comes into the LADO, what then actually happens in terms of that initial gathering information to help the LADO make a decision, who's involved with that, what information is actually shared, and how then that is then translated out, because that's the, if it's not sort of, if you like, dealt with effectively there, whatever decision is made then does create everything else after it. That seems to be the crucial bit of once that information. So who could actually be involved in that and how it's then discussed and what decision is made then.
So there are statutory processes that we follow when information comes into the local authority, and a decision would be made about whether we would call a LADO conference and invite people to attend. And we do that. That bit there, is that the bit you're talking about when the information comes in? Just so I'm really clear.
Yes, it's just that the initial sort of internal bit, and because there seemed to be some discretion listening to different parts of it over some elements of that and who may be involved in being asked for information and where that information comes from. Because once it's out of that sphere, it then has to follow a certain route, which then becomes very restrictive.
I think the question you're asking is about thresholds.
It might be around thresholds, but also who's party to actually discussing that information to make those decisions.
So that would be the LADO, the manager, and where relevant, possibly we might seek legal advice as well, depending on the nature of the allegation that's come in.
Yeah. Are they restrained to ask anybody else for information initially?
It would depend on the nature of the allegation.
This is the bit that I just wondered that we could find a little bit more about what discretion is there and who can participate in that initial fact-finding, gathering information.
Yeah. Can I just interject? If there isn't actually an answer right now, perhaps this is something you can find out and come back on.
Yeah, that's absolutely fine.
Okay, all right. Thank you. And thank you as ever, Kevin, for your very in-depth questioning. David and then Paul.
Thank you. Could I just go back to section 10.3 again of the report, which Paul asked about originally, and he sort of answered. The number of missing children has gone up to 95, up 56%, and we know that it's not from children in care. And you suggested also that hopefully there's better reporting. I just want to see what the reasons were for that rise. Is it a real rise or is it just better reporting?
So guess one of the things that I would say about the police data is rolling data, whereas the data in terms of children and adults is the financial year. So there is a bit of an overlap in terms of their data. What we've got is we've got three children who are missing from care. So that's an improved performance than the year before, where we had 10. But the repeated missing would be children who are not in care. Yes. So those would be children either at home or in their community that the police are supporting. And obviously we, as a local authority, we generally would be involved in supporting those as well.
Okay. Do we know the reasons why they're missing?
There's generally a combination of reasons. Some of our children go missing or leave home because they've fallen out with their parents. They don't want to be with extended relatives. For some of our children who do come into care, they're at risk of exploitation, and there are some outside forces trying to influence them about not remaining in the placement. So there's a variety of reasons as to why a young person would either leave home or be absent from home. Obviously, missing means that they're out of their home for over a period of time. So we would want to record all of those instances and look at an understanding of what are the factors, what's the support that we can put in place through our third sector or other organisations to stop those young people going missing. Because going missing is really serious. It puts them at significant risk of harm. Yeah. So we triage every one of those individual cases.
Thank you. I just wanted to go to page 52 of the slide deck, section 3.1. It's regarding safeguarding adult reviews and continued work to undertake work towards recommendation from previous safeguarding adult reviews. Is there quite a lag on this? If we're looking at undertaking work towards recommendations from previous reviews, I mean, I get, for instance, it could be a quick fix in terms of someone needed some education about a particular pathway, and I get that there could be a cross-area policy that needed to be reviewed and rewritten. I just wondered, though, here, is there a delay within our processes at all?
I'm afraid I'm going to have to take that away. I'm not the lead for safeguarding adults, but that would be my colleague Suzanne Westhead. I'm happy to take that away as a question and find an answer for you. But again, all of these annual reports are done a year behind, so this is the report for 22-23. Yeah. So it's always the nature that we're reporting after the fact. But what I would say is that we've one of the subgroups of the safeguarding board is the practice review group, and we regularly review the practice around safeguarding adults, safeguarding children, and domestic homicide. Those meetings tend to be monthly, so there's a very active involvement in learning as soon as things come through. But the reporting in terms of the annual report comes much later.
Thank you.
Perhaps actually, because our next meeting is actually on adult services, so but maybe it would be timely to have Suzanne there, wouldn't it? Yes. Okay. Thank you, David. Paul and then Joanna.
Thank you very much. So I appreciate this isn't a council paper, it's a wider paper. But I'd like to just sort of now just ask you a couple of points about the child sexual exploitation and how those figures were. Several years ago, myself and Andy Furs discovered, or whatever, reported to the police a major ring that was bringing people from outside this country, hosting them in Bath for a bit before they got shipped off to Dublin to be exploited. So when we look at these child exploitations, is this crimes associated with our young people? And how does it take into place the internationalisation by the big criminal gangs of this stuff? And how do we record that if we find one of those?
And can I just say, before we get into too much detail on child sexual exploitation, we do have a future item on a future agenda, so we can explore that in much more detail as well.
So what I would say is that we work very closely with all of our partners in terms of recognising any vulnerabilities. We certainly within Bath and North East Somerset have had an increase in young people, both being victims of exploitation, but in some cases them also being part of offending other young people. So we work really, really closely. We have a joint protocol and a meeting with the police, which is called the PREV, where we look at all of the issues surrounding children and young people. We look at, are there any county lines? Are there any international lines? We look at what disruption can take place, so that ultimately what we want is to remove young people from those situations. But it is something we work in day in, day out with our partners in the police and other agencies.
And just a small follow-up. So what I like to see is graphs so you can see trends. And a year-on-year trend is not a trend. It's just a difference between last year and this year. So could we request back to the people who produce this that when they do these figures, we also get a graph of trends so that we can see actually really what's happening over time? Thank you.
Yeah, happily to do that. Thank you.
Thank you. Joanna?
I don't know if this is a stupid point to make, but there doesn't seem to be anything about online behaviour in this report. And as we know, like 50% of all use of the internet is pornography. So clearly there's a whole load of stuff going on, and there's nothing in here that deals with that major element in most people's lives, full stop, whatever age they are, that's going on. And I just wonder, where is the safeguarding going on? There is nothing in this report.
I'm happy to take that back to the report author, that there's been insufficient focus on that area. It is addressed through the work of the subgroups of the BCSSP, but
there's nothing. I mean, absolutely zero. I mean, I'm shocked because I'm thinking, well, have I actually misunderstood what the report is about? No. That's a major failing of this report, then.
I will take that back. Thank you.
And we know that it is also a key area of work for the police as well.
Thank you. I wanted to pick up a couple of points. This is back around this section 10.3, and some of the points have already been raised, but it's quite interesting that a number of these figures have actually gone down, which is really good news, but the point's just been raised about having some sense of what's gone on and what the trends are rather than just one set of figures, and also in the whole report having recommendations at the end of it, so at least we've got something we can measure next time. For me, the whole issue around children and abuse is just huge, and tackling it is really complex and really difficult. And for me, much of that is, what we're doing or not doing within schools and other areas. And if we're going to look at this in a future report, that's great, but could I ask that we have some of that work, what is Baines doing around that, to raise awareness? If we're not showing children in school how to treat each other with dignity and respect, where does that end up? We saw what happened at the weekend with some of that not happening. So I think it would be really helpful if we had some of the things that we're already doing, all the good practice, and then perhaps we can have a look at some of the things we might do. Thank you.
Thank you, Leslie. I think we'll take some of that away for the future work plan for this panel as well. Sorry, Mary, were you about to come in?
I was just going to say, I think those are really helpful reflections, and I certainly will take those back to the chair of the Safeguarding Partnership about how we can capture those areas in the reports, because there is some really excellent practice happening, and you're right, it doesn't jump out of this report. Thank you.
So I'm just picking up on Joanna's point as well, with as we've got an item on CSE coming up, maybe we'll pick up online within that too. Liz?
I have no questions. I think they've all been answered.
Okay. In that case then, thank you very much for your full answers to that paper. We now move on to Children's Services Complaints and Representations Annual Report, which is to note. So I'm not expecting a presentation on this, and if I may, we will just go into any comments or any points that want to be raised by the panel, because of course the Cabinet member's already introduced it. So.
Well, Chairman, I was going to introduce now the free school meals, but...
You're so just into the future, aren't you, really? Yeah. Okay, so are there any comments anybody wants to make on this report? Because, as I said, it is for noting, and I'm happy just to move to note if that is requested. Kevin?
Yeah, on page 108, on 4.9, I just wondered what concerns the young people in care are raising.
Varied, I think, is the answer to that. Often about the number of placement moves they've had over time. We did have a couple of complaints soon after the lockdowns and young people feeling they'd been restricted beyond the regulations. But I think primarily it's not being heard, and that will result in placement moves or decisions being made that they aren't in agreement with. We have had some over the last couple of years where young people feel that their cultural identity hasn't been fully recognised and perhaps they haven't had access. We had one young person who has had to live in Wales and didn't feel the community around her supported her cultural identity. She wasn't able to join any groups that she felt she would have done around Bath and Bristol. But I would have to say the issues are quite varied. There aren't some strong themes there.
Thank you, Sarah. And David?
Could we just acknowledge how great it was to see all those heartfelt compliments in the report as well?
Yes, actually, that's always a nice addition, isn't it? Yes. Thank you. Okay, so thank you very much. I think we will note the report, and thank you for all of your efforts in this, and it's great that you have received so many compliments as well. But the points that Kevin was raising about looked after children, maybe we can pick those up as well within the corporate parenting session too. Okay, thank you. Right, now we move on to free school meals. As long as that's where you think you are as well. Councillor May?
Yes, I'm not going to introduce. I'm going to listen to this item, Chair, because I had a briefing with Richard the other day about it, but I think it is something that I'll hand over to Richard if I can, Chair.
Of course, yes, and I note that we are to note, but it is an area of has always been of great interest to this panel, and so, Richard, is there more that you wish to add to the report before us?
Not particularly, other than the report is effectively in two parts. One is about the free school meals and the entitlement and the number of pupils, etc., and the impact that has on funding for those pupils in schools, etc. And the second part is about the school food standards, which has effectively come from the Public Health Department. So it's really sort of trying to bring the things together that we thought you would be interested in hearing.
And thank you. And I know it would also be useful, I think, to be able to break it down further, perhaps, ward by ward, to know perhaps where there is a greater amount of uptake as well, because of course this has such a big impact on some of those other services, whether or not that's pupil premium or access to the holiday access fund or whatever else too. So it would be useful as well as that to know how many you estimate are not applying for pupil premium, particularly in the primary age, because it's now built in as opposed to having to be applied for. I'm sure you know exactly what the question was I was asking there.
I think the question is, from what you were just saying, is can we identify so we say numbers of pupils who are eligible for free school meals but have not made an application. And the answer to that is quite simply, we can't. Because we don't know, unless the parent actually makes an application, we don't know that they're eligible. And we are not allowed to actually try and find out effectively because of GDPR purposes. Okay? So ideally, if the government could bring the two departments together, as in the DFE and the DWP, they could cross-reference all pupils across all benefits and cut out the middleman of the local authority making the assessments. But that's never actually been achieved. So we are where we are.
It is very frustrating. Now, the second part of my question, which I sort of did mix up a bit, was it possible to break the numbers down on those that we know are in receipt of free school meals to a ward by ward, so we had a ward by ward picture?
Not 100% certain, but we probably can. But whether or not the data is available easily, we can break it down by school easily, because we hold that data. In terms of by ward, it's usually a little bit more complicated as to whether or not the parent is resident in which ward and things like that. So by school level, we could do it relatively simply. That would be really easy.
I think school would be fine, and I've very much used Chair's privilege there to come in before anybody else. Okay, so panel, any questions? Kevin?
Thank you, Chair. I did submit some questions which I hope Chris has got or had. I don't know whether, Chris, it's easier just for you to run them through and just give us your answers, or whether you want me to ask them individually and then you ask.
So I, being the effective director, I pass them on to Richard.
Delegation is always an art of leadership.
If I remember correctly, Kevin, your questions related to the table 3.2 on the report, and whether or not it included the pupils who are receiving free school meals by the fact that they are just in the Key Stage 1 element of our things, and they do not. So these are purely pupils who are eligible by benefit. Okay? So there is approximately 5,157 who are also getting free school meals by the fact that they're in our Key Stage 1 provision and get free school meals as, in a sense, an automatic entitlement. And that is part of the complication, in so much as because parents are getting that automatic entitlement, a lot of them are not applying for the free school meals by benefit, which causes the difficulty. And the report then tries to explain what we try and do to advertise that through the various processes. And yes, we do, as part of the admissions process, Kevin, because that was another one of your questions, whether or not we advertise that through the admissions process, and yes, we do. We provide letters specifically to schools and to parents as part of that to try and encourage them to apply.
Does that go out in the
yes.
in
the general
LA brochure? Yeah.
Can I just follow up from that question then, which is, I think we should be doing more and maybe using different mediums as well to do that, because I'm not sure everybody who perhaps ought to be claiming is necessarily reading every single bit of paper that comes either into their inbox or through the post.
I agree fully. We try and do as big a coverage as we can. We use social media through the One Big Database. We use libraries, digital screen boards, etc. There's a whole range of things that we do, but you're right, there are still some parents who are falling through that loophole and not making applications.
And maybe using some of the social media that they might be more inclined to be looking at, bearing in mind these are younger parents as well, different generation. I'm not suggesting at all, Paul, you'll be pleased to hear that you go onto Snapchat or TikTok.
It will go on our council Facebook page and other social
media. And I think the other questions that you had, Kevin, were related to where the sort of break-even point for providing free school meals in individual schools was. So I think your question is, when does it become viable for a school to run a free school meals, shall we say, or a meals service? And the answer to that is really, it depends on the individual school. There are some schools that have a lot of pupils who will buy meals and therefore effectively subsidise the free school meals element of the process. And there are some schools where they get very little paid meals. In terms of free school meals, the actual funding that ends up getting into a school to provide a meal is £2.53 per meal. And that £2.53, when accumulated up for all the pupils who are eligible, whether they be by benefit or as free entitlement as Key Stage 1 pupils, effectively totals the resource that they have available. It will then be dependent on the individual school as to who is providing the meals for them. So in some schools they provide internally with cooks and kitchen staff and provisions bought by the school. In other schools it is a contract to an outside provider, etc. And it'll depend on the circumstances of the school. We have had, some schools that have got, I would describe, very good catering kitchens. They have the ability to make meals, and yet school down the road has got no kitchen whatsoever and has to import meals and try and keep them warm for the pupils in an appropriate fashion. So there is a total mixed bag, and it is impossible to say what is the actual cut-off for what is a viable free meal service. Sorry, Ken.
Yeah, which is hence the problem of trying to simplify the problem, but obviously I realise it is complicated, but there are numbers of schools reporting whether it's they're not a production kitchen, so they buy in meals, but then they have an extra 10p on top of each meal for delivery, which means it's £2.63 per meal that it's going to cost them as opposed to £2.53 and so on. So it's always one of those interesting dilemmas, but it'd be nice to simplify or have an idea of what can be provided. So it is the same provision of, you say, a hot meal. Is it always a hot meal? Because I know some schools buy in sandwiches, and the nutritional presumably standards are met both ways.
The nutritional standards can be met by a cold meal, as in sandwiches, etc., or a hot meal. I believe up to last April, every single one of our schools was providing hot meals, but we had a bit of a problem with an individual primary school where the contractor handed their contract back in roughly around about Easter time. And I am not certain at this point whether or not they've managed to recreate a hot meal provision, so they could be providing sandwiches. There were several, I would say, inquiries from parents who were concerned about that at the time. But that has gone quiet, so I presume they may well have now got a new contractor. But it is, the nutritional standards can be met with a sandwich, and it's not as my mind appetising as a hot meal, but you could find that it might be more tasty to some pupils than others. So it's...
Okay, and the last question was around that holiday period vouchers.
Sorry,
well, the number of holiday vouchers seem to have been rising significantly since 2020 and still rising. But I was wondered if the pupil population in Baines was declining yet, and if that is, are we saying that there is greater demand, even rising for these holiday vouchers, and that is magnified because the proportion is shrinking?
The answer to that is no. So at this point in time, the pupil population in Bath and North East Somerset schools is actually, I would describe it as stagnant. It is almost identical as it was the previous year, and literally a handful of pupils different from the year prior. So in the last 2 years, it has moved by less than 20 pupils. So it's actually, I would call it flatlined at the moment, which is good in a way. Because
it is good. It's surprising because I've had a number of colleagues say reception classes aren't full and funding is becoming an issue.
Yeah, there is a reduction in the number of pupils in our reception years. However, there's a greater influx in other years throughout the primary sector due to house building, etc. So overall, the population is stable, but there are individual schools where the pupil population is dropping rapidly, and that is primarily in primary schools.
Thank you, Chair.
Thank you, Richard, for answering all those questions. Oh gosh, you can't put your hands up at the same time. Chris and then David.
Thank you. We used to get pupil numbers in school, etc.
Can you use your microphone?
We used to get pupil numbers at one stage. In schools and all that. Yes, that's right, yes. Which is always very interesting. Well, I always found very interesting. And it's one of the things that I miss.
Sorry, I'm doing it now. Is that something we could have, just to see what the trends are?
The school organisational plan, which has to be done annually, is actually just about to go out to consultation. So it could easily be brought to the next panel as part of that, as a report of what's in it. So it's all our schools' pupil planning population of all our schools.
Thank you, Richard. Yes, that would be great. David.
Thank you. With respect to the holiday activity programmes, there are only 3 days of offerings of activity in the Chew Valley in my ward. And I was just wondering how it worked for the more peripheral communities, the rural communities, to get access. I wondered if you had any data with respect to unpaid places where people are taking advantage of all the offerings.
I don't myself. I'd have to go back to the team that actually organises the Holiday Activities Fund and ask them. It's something we can look into and.
Yeah, thank you. I wasn't expecting you to have it today, obviously. But it would be really nice to know if hardly any of the kids in my ward, Chew Valley, are accessing any of these facilities at all, because we don't even really have much bus network now. Anyway, thank you.
That goes back to the point we made before about the impact of reductions in other services like buses. And actually, that would be useful to have across the whole of Bath and North East Somerset as well, around access and whether or not whoever is running our holiday activity programme is properly targeting all those areas where there is need.
Chair, we could ask the relevant service to give an update on that.
Thank you. Okay. Any more questions on school meals? Paul and then Liz.
Yeah, thank you. 3.18, I'd like to say to our Cabinet member that from my perspective, it's very important that this funding continues when you're doing your budget with your Cabinet colleagues.
I think we'll all agree with that. Yes, we would all agree with that.
I'm glad you've asked that, Paul, because I was going to ask Richard that as well.
The Welfare Support Fund grant,
The Welfare Support Fund grant that funds the holiday school food vouchers is effectively ending next March the 31st. So what the authority has managed to do is to utilise that funding into the Easter holiday period. A decision as part of the Council's budget planning will need to be made, and it has been, I don't know whether it's been put forward or not. I'm not sure what the process is as to whether or not it has been put forward. It comes from the Welfare Support Fund team, which is part of the Finance Department, Revs and Benefits, but I'm not sure whether or not anything has been put forward for future funding
I don't know is the answer.
Well, then we expect to see that being put forward by the Cabinet member. I hope I am speaking on behalf of the whole panel. Good. Liz?
Well, actually, he's been asked twice about this, because I asked him earlier on about making sure that we get holiday, school-free holiday vouchers, school meals holiday vouchers during the school holidays after Easter. So he's been asked twice, Paul. Just to say, could I leave free school meals and look at standards in food? And it's quite worrying, Richard, in your report, that you're relying on schools, especially secondary schools, to do a self-assessment in the quality of the food they're offering. I mean, firstly, do you get many of these? Again, it's not statutory. It's a voluntary thing to actually comment on and self-assess on the quality of their food. And secondly, do we have any control over actually what's offered and the quality of food that needs to be provided? And anecdotally, residents were saying to me that many schools, especially secondary schools, are offering snack-type foods, which a lot of pupils do actually buy and prefer to eat, as many teenagers will, compared to your school dinner. So I just wondered, could you answer those questions for me?
Jay, can I add just something to that, which is also about the amount of time that's allowed for school lunches? Because, again, slightly anecdotally, I'm aware that period of time has been shortened and shortened and shortened. So now, actually kids are choosing to get the snacks because it's it is the only thing they can get that fits in with those 25 minutes or whatever it is time frame that they now have for lunch.
I must admit, I'm not an expert on the school food standards myself. That's public health. But the actual standards apply to all food that's produced and effectively sold through schools. So if it's for break times or if it's snack-type facilities, the school food standards still apply. So the schools should still be, should we say, providing suitable nutritional standard food. In terms of the self-assessments, I think we'd have to ask public health as to what we actually get back from them. I believe we don't get very much because, as you say, it is a sort of an optional approach. But I think some schools really do take the sort of school food standards seriously and do, actively, should we say, internally, do that assessment properly. So it could be there could be some information that public health do have available, but I must admit I do not know myself. In terms of lunch break times, that is something for the school to decide. They are, in charge of their whole school day, and they decide what the break should be for lunch breaks and snack times.
I'm aware, but obviously if you've got a short window of time to actually purchase and eat something, you're more likely to choose something that is quick rather than, full of the nutritional standards that you would, as parents, as counsellors, that you would hope for. And it was more of a comment, but I am aware there's little you can do. Joanna and then Kevin.
Thank you. Just picking up on that point, it's also there's very long queues in school. And I know my children never wanted to eat meals at school because the queue took too long, and by the time you got it, everything was gone and there wasn't anything and there was no point and the lunch was over. So it is an issue, even though we can't solve it. I'm just trying to pull together the threads that everybody's talked about so I understand this. So basically we've got schools, but at the moment we don't have the data on which schools have most free school meals because that's not in the report. So what we're asking as a scrutiny panel is that we have all the schools in Bath and North East Somerset and what the percentage is. And then there's also the issue of free school meal vouchers given to play during holiday times, but we also don't know where that is taking place and where they relate to the data on the schools. So there's a whole load of bits of information that don't seem to be there so that we can see the overall picture. So I guess what I'm asking for is that, yes, we really do need the data on all the schools, and then we need to see where the play facilities and offers are taken, and in Bath and North East Somerset, so that we can see if there's a link. But then there's the issue then of the school and what their circle of children coming into that school is from. So, you know, if that's there's quite a few sort of bits there that sort of sit together that aren't telling us the whole story and where the council can have most impact for most children, which also then brings me to the point of playing and spaces for children to play. And we don't seem to have that on our work plan, which we're about to get to, is about where are the play facilities in Bath, and do they best suit the needs of those areas as well? And that would then fit into that. There's a link.
I think certainly spaces for children, leisure is an area that we haven't got on our work plan, as we can certainly make sure that is in the future. I was just wondering whether or not, in light of all the questions that have been raised, whether or not, and excuse the pun, but whether or not we would like a second bite of the cherry of this particular item. Yes? Okay, yes. Okay, so let's, if you can take on board the comments, and perhaps we can build up a report which then we can possibly look to maybe have some recommendations rather than more noting, because I think we have noted, but we see gaps that we'd like to fulfill or fill. Okay?
Can I just add, I think we would need not just Richard coming back, but also it's which other area did you mention, Richard, that we need to look at?
Public health team, yeah.
Chris?
I think
sorry, Leslie.
I think you've asked, the right questions around that. Probably just for the panel's explanation, Richard and his team are particularly responsible for the distribution of the finance that goes into it. This area doesn't look after the quality of the meals in schools or the HAF programme, but we can work with our public health colleagues. We did get some input into the report, and we can ask our public health colleagues to provide a bit more information around nutritional standards and around the HAF scheme, and particularly its reach into the rural areas. We can take that as an action away.
I've just been reminded that we have got an item on food poverty, so actually this would fit neatly into that. So, okay, excellent. Right, Leslie, sorry, I didn't call you.
Yes, thank you. I just wanted to pick up again around the equality impact assessment, because the report says this is a report, so basically we're not going to pick up the issues on equalities here, which may be correct, but if you look at the equality impact assessment for free school meals, again, there's no review date on it, and it's dated 2011, so I wonder if any of the figures have changed. For example, it talks about disabled children around 17%. I wonder if that's gone up, and in other areas it doesn't have any information at all, so it might be worth having another look at that and bringing it up to date. Thank you.
I didn't quite catch what you were actually trying to say with that question. Sorry, just to be clear.
Okay, so if you look at the report, it says there's an equality impact assessment that's not being done because this is a report. But if you look at the equality impact assessment on free school meals, there isn't a review date, and I don't know what actions have been taken around that. And it was written, the date on it is 2011, so the figures may have gone up, or maybe they've decreased. For example, disabled children, it says 17%, but if you look elsewhere in the reports we've had overall, it's saying the costs of ferrying disabled children to school is rising, so presumably there are more rather than less. I don't know whether they all have free school meals as well. But it would be worth, if we're looking at this as a whole another time, to have a look at an updated equality impact assessment as well.
Can we ask that that's built in then to the follow-up report then? But one of the points, just picking up, I would imagine that part of the reason for the increase in costs is because travel has increased in its, in costs. Okay, any other points anybody wants to raise on this paper? I'm glad actually that it's going to come back. I think it is such an important, and it's a real fundamental issue, isn't it, for kids in this area.
It was only a brief comment just on...
Well, you can make a brief comment if you put your microphone on.
It is on, but I need to be closer, sorry. It was only the fact that you were saying about the length of lunch, which quite concur with, but there are a lot of issues, including staffing and resources and where children might be and what they're doing. So it's a complicated one, and yes, schools are in charge, and that might also then impact on support behaviour services, support other services, and why children are where they are and where they're being catered for and their needs and so on. So sadly, it's not just we would love to have everybody sit down and enjoy your lunch. It is a lot more things into that small time.
I am aware, actually, schools have huge amounts of pressures because they're expected to do so many more things than just teach children. Yes. I think Joanna wants to make sure they're teaching brushing your teeth as well after your lunch. Okay. So any more points people want to raise? Otherwise, I will move on to the work plan. Okay. So we're on the work plan now. As you'll see, we have a number of items already scheduled for the 11th of December. You will note also that it is a little bit of a combined meeting with some items that cover both adults as well as children as well as adults on this one, because we can't always neatly schedule things to be wholly children or wholly adults. But we will obviously update the piece on food poverty to include a further update on free school meals. So are there other items that need to be put onto the work plan? Kevin?
Two quick things. One was I didn't know whether, and I just had some information through SG about their struggling communities and struggling families and communities project type stuff. They're consulting or doing other things around it. So whether that would fit in with food poverty or not, whether that was a paper that might be suitable for the food poverty one coming up around the role of the 3SG.
I wonder if we ought to have a separate item actually on 3SG, bearing in mind our earlier conversation around the community wellbeing hub. Perhaps that would, and that would then pick up your points, and also the slight worries that I think we've all got now after Paul mentioned some reconsideration of the budgets for the Community Wellbeing Hub.
And you've got homeless health down twice, just whether there was a reason for that, whether you had different aspects you were looking at. Sorry.
Is there?
Yes. One's on the 11th of December and one's...
Yes, my apologies. I think that's just an error.
Oh, it's okay.
Yeah.
That's fine.
And I think it would... depends. I think there was a specific reason why it was going to one month rather than another. Was it because there was a report expected on homeless health?
That's coming to next meeting in December.
Okay. It was just also it's mentioned again later on in a sort of like the unallocated agenda items. So I think it's just an error. Yeah. Okay. And we also mentioned about EHCP delays, so that needs to come onto our work plan. And that's already on our work plan. So was there anything else that has arisen that is not on the work plan? Well, otherwise, then please let myself, Kerry and Mark know, and Liz know if there is anything that you would like to see that we haven't covered.
Could I just check? Apropos what we were talking about the future, the consultation regarding Charlton House, would we assume that will be part of Councillor Alison Bourne's report?
Yes.
Okay, so we needn't make it a separate...
Well, we would assume that it would be, but if you wish it to be an entirely separate item, then it is down to the panel to ask.
How the consultation is going so far. So I think possibly a separate report, if panel members would agree.
Yes, you're getting nods all around, so yes, we'll do that then. Okay, thank you. Anything else? Paul, are you going to mention anything that you didn't mention earlier in your report?
Yes, so it's just a reminder in my report. If you remember, there was a long debate at the full council about knife crimes, and you've taken that on board of this committee. But we also said that we would talk to the community a bit. So the first event is on the 27th of November in the Keynsham community space. So really just to alert everybody that that's going on. It's from 5:30 to 8:30. So I don't think that's in conflict with anything that the committee's doing, but I thought we'd just bring it back to your attention, and anything that comes out from that will feed back into your review.
Thank you, and I think some of the task group will be in attendance as well. Okay, so this is your last call. Okay, in that case then I will say thank you very much everybody for your time. I think it's been a very useful, interesting meeting, and I look forward to your attendance at our next meeting, and I will now close the meeting. Thank you.